We will come back.
Good afternoon, everyone. I'd like to call the Hillsborough County Emergency Policy Group meeting to order. Will the clerk please call the roll?
Miller?
Here.
Overman?
Here.
Merman?
Here.
Cronister?
Here.
Castor?
Here.
Ross?
Here.
Watt?
Here.
Snively?
Here.
Merrill?
Here.
All right, you have quorum.
Thank you very much. We're now moving to public comment. We set aside 20 minutes total for public comment. Each speaker will have 2 minutes. Our first speaker is Greg Reynolds.
Hi, Mr. Chairman. I wanted to say that it would be a complete failure for this body to believe that we either have to shut everything down or do nothing at all during this crisis. I was extremely disheartened that Dr. Holt, who took an oath to do no harm, said on Monday's meeting that we should not put into place any administrative restrictions because he has hope our community will be smart. We've seen firsthand the harm caused by that philosophy, and the reason that we've elected all of you is to lead and not just simply hope that things will get better. There are some common sense solutions that can be put into place. For example, everyone who is able to telework in this county should be mandated to do so unless it causes an undue hardship to their employer. Places can be limited to a maximum capacity of 50%, indoor and outdoor, and these same places should have designated hours for their vulnerable. And just as we have outlawed smoking inside of buildings, we can also mandate facial coverings be worn when people are inside of buildings, wherever that's practical. And none of this violates anyone's individual rights. It's the responsibility of this body and all of you to protect the individual rights of all of those whom you serve, and that includes the health and safety of everyone in this community. You guys have the ability and the responsibility to enact common sense measures, and to not do so because some in the community feel it's an overreach or because the virus has a low death rate is morally bankrupt. 100% of people who get the virus do get sick, and they remain sick for quite some time, even if they don't die. And at this point, over 3,000 Floridians have died. Over 115,000 Americans have died, and millions are being sickened, and it's only getting worse. So I would implore you all to take action and stop talking about this issue before it gets out of control. Thank you.
Thank you, sir. Jennifer Cantor.
Good afternoon, Chairman. My name's Jennifer Cantor. I want to thank you guys for the work you've been doing for many months to make the hard decisions that we need to keep our community from being overwhelmed by COVID like some of the other cities we've seen. You guys issued our local safer at home orders several weeks before the state order went out. You based that on our county's unique needs, and it's time for you to take some decisive action again. The governor was clear that he is moving Florida to the next reopening stage soon. This choice may make sense for the state as a whole and may even make sense for some other counties with lower population density. But it is clear from the reports that have been given here in recent meetings that we have community spread and that our county is not currently meeting the governor's plan criteria for moving to the next stage. We have not had 2 weeks without increased counter positivity rate, and instead those numbers are going up fast. The EPG needs to act to slow our infection rates again before the governor moves us to the next stage. One option could be to declare that the county will be holding at the current stage until we have 2 weeks of downward trajectory. Another would be to mandate mask use indoors like Mayor Kreisman just did in St. Pete. It is urgent that the EPG again take the hard steps needed to slow the spread of this virus early enough to prevent a crisis in our hospitals. Waiting to pull the trigger once the hospitals reach the stress point will be 2 weeks too late to prevent needless death. You guys have had the opportunity to have Dr. Holt advising you. He's the best. Listen to his data and then keep asking questions about the implications those trends have on the next week and the week after. Nobody wants to stay closed longer or live with restrictions longer than necessary. But the governor has given you guys the responsibility to prevent this disease from overwhelming our county's healthcare system. You're running out of time.
Thank you, Ms. Cather. Your time is up.
Thank you.
Thank you. Leslie Forrester.
Hello, my name is Leslie, and I'm a business owner in Hillsborough County. I believe that mandatory masks in Hillsborough County would help immensely to slow the current rapid spread in our area. Over 1,300 new cases just in our county in the last 7 days. Pinellas had 958 in the same time period, and they are instituting mandatory masks for business employees on Friday. And it has been mandatory for both employees and customers in businesses in Miami-Dade and Broward counties for some time. I believe that the emergency policy group should keep meeting, should vote to tighten restrictions, and should set distinct benchmarks in advance for when we will phase back down to save the greater Tampa Bay area from itself. Use the data kept current on the COVID Department of Health and Community dashboards to set numerical benchmarks for when we should walk back from phase 2 into phase 1, probably now, although people won't accept that very easily, and then again back to a full shelter-in-place order. Perhaps if the residents of Hillsborough County are informed that if we get to a steady rise in cases over X number of days, or a certain percentage of positive tests, or this percentage of hospital capacity, then we will lock back down. They will do the relatively simpler thing and just wear the darn masks already. No one seems to be taking this seriously, and we cannot sustain a New York City peak level of cases in our healthcare system. I encourage the EPG to defer to data and science when making decisions rather than politics. COVID-19 doesn't go away just because we got bored with it, and exponential growth means that every day we delay action has serious consequences. Thank you.
Ma'am, can I get your first and last name for the record?
Her name was, I think that was Leslie Forrester.
All right, thank you.
Okay, now I've been sent an updated list, and I'm going to have to go through this, and I don't know if some of these people have maybe have spoken already. So I'm going to go back to the top. Did Greg Reynolds speak? Did Greg Reynolds speak?
This is Glenn with Hillsborough Television. Yes, sir. Craig has spoken.
What about Jennifer Cantor-Hugh?
Yes.
She's
Yes.
Yes.
Mm-hmm.
Who? No, I'm hearing 2 or 3 people talk. I'm asking the staff. Who did Jennifer Cantor-Hugh speak?
Yes,
Yes,
she
sir.
did.
Jennifer has spoken.
Okay. What about Kathy Telford? Catherine Telford.
I have not spoken, no.
Okay, go ahead, ma'am. You have 2 minutes.
Thank you. To the Hillsborough County EPG members, my name is Dr. Catherine Huff-Telford. I'm a longtime Hillsborough County resident, and I now live in Tampa with my family. I'm a board-certified pediatrician who has received 2 additional years of training in pediatric infectious diseases. Because of this expertise, I've been privy to the latest pandemic research and guidance. It is out of this knowledge and concern for my fellow Floridians and Hillsborough County residents I'm speaking with you today. I want to emphasize the recent increase in cases and hospitalizations are not only due to increased testing. We've been testing widely for weeks, but only in the past week or so have we seen an increase in cases and hospitalizations. The best estimates show that SARS-CoV-2 has a mortality rate of 1 to 2%, which is at least 10 times the mortality of the flu virus. Already in the past 3 months, there have been 3,000 plus deaths in Florida. To give context, in a bad flu year, influenza kills around 3,000 Floridians. Those who do survive severe COVID leave the hospital with long-lasting, often disabling consequences. Their lives will never be the same. So how do we curb transmission in our community before a vaccine is widely available? The answer is wearing masks. Dr. Atul Gawande in his New Yorker article summarized it well. If at least 60% of the population wore masks that were 60% effective at blocking viral transmission, which a well-fitting cotton mask is, the epidemic would be stopped. The more effective the mask, the bigger the impact. Hand washing, standing and sitting 6 feet apart, being outside, etc., are all good measures that must be performed but are inadequate to protect the population. The overwhelming evidence showed that widespread mask wearing is the way to save lives and livelihoods. Masks allow us freedom to engage in the community while simultaneously mitigating the disease risk in a meaningful way. Physical distancing, sanitizing techniques are all important, but unfortunately inadequate at stemming transmission. To speak candidly, only utilizing these measures falsely reassures the public. Additionally, there is no evidence that in a pandemic, masks confer harm. Despite the recent confusing statements from the WHO, asymptomatic or pre-symptomatic transmission has been shown to be a significant driver of disease transmission.
Ma'am, your time is up. Thank you very much.
Okay.
Thank you. Jake Hanaway.
Good afternoon, everybody. I appreciate the opportunity to comment. I had 3 topics I wanted to comment on. First, Greg's idea about mandating telework. I apologize. Jake Hanaway.
Thank you.
Thank you. So Greg's idea on telework is excellent. I think the board should take that up. Secondly, testing and tracing is going to be very important in getting this thing under control. And earlier this week, I scheduled myself a test for me and my wife, and I was on hold for 30 minutes, and then my phone got cut off. I called back. I got on hold for another hour before I could book my test. So if there's anything that the county can do to devote more resources or set up a web page. I didn't talk to anybody that scheduled this appointment to talk to y'all. So there are a lot more people that need tests that are calling in. Lastly, about the masks, there's no cost. There is no cost to wearing a mask, even if it's right or wrong. It doesn't hurt anybody to wear the mask. Additionally, I want to commend Mayor Castor and Commissioner Oberman for making their proposals to mandate mask wearing and allow for employees of businesses to wear masks, whether or not the employers are okay with it. Those are both excellent. Chairman Miller has said in the press that we can't get it done right now. Personally, I'd like to know who is obstructing it politically so I can dedicate my vote and my advocacy accordingly. Again, thank you for the opportunity to publicly comment, and look forward to hearing what you all have to do. Thanks.
Kyle Mord.
Good afternoon. My name is Kylie Mord. I'm speaking today in regards to the current restrictions that are in place for youth soccer tryouts in Hillsborough County. The governor lifted restrictions for youth sports and camps a few weeks ago, and so I'm unclear why Hillsborough County has not done the same. Clear written communication posted for the public to view as to what needs to be in place in order for youth sports in Hillsborough County to be fully operational would be helpful. Surrounding counties have already held their tryouts the last week of May, first week of June. So again, I'm unclear as to why Hillsborough County, we are unable to remove restrictions. I know this concern may seem small in relation to all the other issues, but to my kids and many others, it is their world, and they just want to get back to it. As parents, we have already signed the waiver that states we will do our part to keep everyone safe and follow the guidelines put in place, as well as we understand the potential risk and agree that Hillsborough County nor the club is responsible in the event anyone gets sick. Please allow those of us that are ready to return to the field the opportunity to do so. And as it pertains to the media's new numbers of it spiking in Hillsborough County, I just ask the board to please continue to ask questions as to those numbers, and are those numbers due to increased testing? Are those numbers leading to deaths? Let people that are ready go back, and let those that feel they need to wear a mask, they can wear a mask. Those that feel they don't. It should be each individual's right and their choice. And if it's a business owner that wants people to come into their business with a mask, then that's their choice. And so we can choose to go in or not go in, but we need to have choice. That is why we as a country are the way we are. We need to have choice, and we need to maintain our constitutional rights to have those choices. Thank you very much for your time.
Beth Snyder.
Yes, this is Beth Snyder. I'm a lifelong resident of Hillsborough County. Thank you all for having these meetings. I really do appreciate that you give us not all the information I would like, but a lot, and a lot more than some other places. I would just like to encourage the group today, as they're looking at the numbers and talking about what could or couldn't be done to slow down the spread of the virus, that you are potentially sending some very mixed and contradictory messages to the public that could potentially backfire. You're asking people to take this virus very seriously, while at the same time you're allowing and even encouraging mass gatherings that at this time contradict the state of Florida guidelines for no more than 50 people. That erodes trust, and there's a lot of people that are questioning why that is allowed, and at the same time you're contemplating all of these extra restrictions. There is a block party being advertised for Centennial Park in Ybor City for 5 p.m. tomorrow that is going to have a DJ, and it's a party, and it's obviously going to have more than 50 people attend, but yet that seems to be okay and even encouraged. And I would just, again, urge you to very carefully think about the message and what you want the message to be to all the citizens of Hillsborough County. Thank you.
Ashley Fox.
Hi, good afternoon. My name is Ashley Fox. I've seen some discussion on the potential for a new requirement for businesses to report positive cases in their establishment to the Florida Department of Health. And I was just hoping that you could provide some clarity as to what the requirements will look like in terms of logistics in getting that information to the Department of Health.
Okay, ma'am. Thank you very much. That's the last speaker we have for public comment. So we're going to close public comment. Mr. Dudley, Emergency Management Update.
Good afternoon. We continue to support Raymond James, Lee Davis, South Shore, Plant City, Brandon, Waimama, and Sun City collection site, as well as home testing operations. Last week, the teams were able to accomplish 3,335 tests. Total tests to date, 31,068. Testing conducted this week, as of to date, 2,660. We had 3,553 appointments scheduled for last week. We have 1,497 appointments remaining for this week, Thursday through Saturday. Also, if you do need an appointment, do please call 813-272-5900. Logistics, numbers continue to increase on the levels of PPE. We continue to push out to those requiring that equipment. We've had no changes in donations. We have 0 individuals in the quarantine site and 15 guests checked into the isolation site. We continue to support long-term care facility testing. This week, Hillsborough County received 540,000 cloth masks from the state for public distribution. We will be working with our community partners, neighborhood relations, municipal partners to distribute these masks to the public. We continue to distribute masks at our testing sites as well. And we'll also be working with our transportation partners also. This is the first round of those masks. We have another order in. And as we get those masks in, we're going to work hard to get those out and into the hands of partners to help us get those distributed to the public. This concludes my update. Any questions?
Okay, thank you, Mr. Dudley. Ms. Snively, you recognize.
Thank you, Chair, and thank you, Mr. Dudley, for that update. Could you remind the group what is your daily and or weekly appointment capacity now that we've added some sites? What is the maximum amount of appointments that you can take, or a maximum amount of testing that you're able to handle on maybe a daily or weekly basis? And what % are we at capacity? I have heard constituents now having challenges making appointments, like the gentleman in public comment, and some other folks have reached out to me saying that they've been on hold waiting to make appointments. And I'm just wondering, are we close to hitting capacity every day or every week on the number of appointments that you can take? And then my second question is, well, go ahead. If you would go ahead and address that first, and then I'll pose my second. Thank you.
Yes, ma'am. We right now, Raymond James, we just recently had Raymond James set at 500, and depending on the demand, we'll adjust those. Some of the smaller sites like D. Davis, Plant City, and South Shore, we set those at 300, but we do end up exceeding that capacity on both accounts. And this week, as well as last week, we've had an uptick in the call demand. We have had some challenges this week. The demand has been high, and we did have some technical issues that we've since worked out. And as of this morning, we'll be adding 10 additional call takers to help facilitate in reducing some of those wait times. But the public is responding to the information they're receiving, and we're hitting that demand. Raymond James, as the demand goes up, we had a capacity to move that back up. We usually have that around 600 to 700, depending on the demand.
Thank you. So it sounds like you're pretty close to capacity at all of the locations. And then the second question I had was the logistical aspect of setting appointments. And obviously it takes takes manpower to be someone to hire someone to answer the phones and possibly create additional phone lines for fielding calls for appointments. Why aren't we doing that online? Why aren't we creating a portal or some type of online appointment setting system where people can just go online and find available slots? I think I don't know the cost difference between that and hiring people, but as a business owner, I would think that would be a less expensive route than hiring manpower to answer the phones.
Certainly, we're looking at every avenue to increase our service. Actually, that's been become a topic of discussion with our communications department, that we explore an online option. So I hope to have some further information on that and how we can accomplish that task. So that's certainly something we're taking a look at to ensure that we can provide the service needed for all this additional testing.
Okay, thank you. I look forward to some future updates on those. Thank you so much.
Absolutely.
Mayor Castro, you recognize.
Thank you, Chair. My questions were going to be along the lines of Ms. Snively, so a lot of that has been answered. One of the things, though, Mr. Dudley, is do you keep the data how long individuals are on hold so that information would be available? Because I received a lot of those calls as well about either the delays or the inability to get through. And clearly, if we're having the increase in the calls for appointments, then the testing is going to increase dramatically. So just to want to be reassured that we are prepared for that. And I too echo Ms. Snively's idea of the online portal. Seems that that would make it a lot easier to control these application processes. That's it, sir.
I will take a look at that whole time data, and I can push that out as well.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. And I have also received constituent calls that have been put on hold and no one ever came back to them. If it's a whether it's a manpower or online portal, I guess, Mr. Merrill, I'll just ask you if you can get the right staff on this to make sure that we can address this situation before it gets out of hand. With these numbers increasing, I think more and more people are going to want to get tested. So I don't know if you have any comments, Mr. Merrill, but hopefully you can get the right people in the room together and try and figure this out.
Well, Liana Lopez is going to be on the agenda a little bit later, and
okay,
she can talk about that call center operation.
Okay, and are we, when one of the sites is full, are we routing people to other sites, Tim?
And Liana can touch bases a little bit.
Okay.
So we receive calls, and we do have some backup support for the calls because we're not just receiving calls just for testing. It's for all the community support and the services that we offer here in the county. And then they're routed to the call center line for scheduling for the appointments. Yes, ma'am.
Thank you very much.
Okay.
Mr. Dudley, let me ask you a question. How many people are we averaging testing per day?
We are, let's see here. Let's see. Let's see. For the week of we're averaging between, let's see here. I'm trying to pull that up. I think we're doing around about 500 per day.
Okay. Go back to the slide.
This is from the county collection site.
Right.
This is not as a community as a whole.
Okay, go back to the slide you just took down. You had a slide up. No, not that one, the other one.
This one here? So
on hand, you have 2,388 test kits on hand.
Correct.
Do you anticipate we're going to run out?
No, sir. We'll have our weekly delivery come in. So I have no concerns that we'll be able to have the resources. So we're averaging about 575 tests per day between the sites.
Okay, just want to make sure. Mayor Lott, you recognize?
Thank you, Mr. Chairman. I've heard the same complaints about the amount of time sometimes to be able to get an appointment and so forth. But I've heard the staff does a really good job when they are able to answer the phones. But I thought we were sharing with the public that if you can't set an appointment, but if you still show up at a testing site, we're not going to turn you away, but we'll test you anyhow. So whether you have an appointment or you don't have an appointment, someone in Hillsborough County can go to one of our testing sites and get tested. Isn't that correct?
Yes, sir. We still encourage folks to schedule an appointment so that we ensure we have all the supplies that we need on hand on site. We do have walk-up capabilities. Walk-ups have increased, as you can see here on the chart. So we've been increasing on all levels. But for the serviceability, we do encourage folks to try to get the appointment, and that helps our staff to better manage the sites. But if someone
wants to get tested and for some reason they can't get through, they can just go to one of our testing sites and get tested, correct?
That is correct. Again, just so that we want to have a proper messaging out there to ensure that we have all the resources that we need on site. We don't want folks to circumvent the appointment system, but we do have the walk-up capability to do so.
Okay. Well, I appreciate that. It's just that some of the individuals that I'm speaking with are waiting an extra day or so trying to get their appointment set. And I just don't think that's what we're wanting to happen. If someone believes that they need to get tested, and if they can't get through, and I agree, if they can get through, but if they can't, go ahead and go down to the testing center and get tested, I would think would be is the smart decision, At least I hope that's a smart decision. But thank you. I'm glad we're not turning people away if they don't have an appointment. Thanks.
Commissioner Overman, you recognize.
Thank you, Chair. And thank you, Mr. Dudley, for your report. That was very helpful. And clearly, we've seen an increased interest in testing, which is excellent. I have also heard there's challenges. And part of the screening process does make sure that the person that's needing to be tested is being tested in the proper way. We recently had a correction officer that attempted to schedule an appointment through the county center where they have resources with different types of tests for first responders. So the call center does help screen those calls to make sure they're getting the right test. But I also have heard that the local partners in this effort are at capacity in some respects. For example, if you're going to CVS to get a test, there is no available tests through that venue within Hillsborough County at the moment. So we are clearly seeing an increased interest in tests. And as we are going to see continued increase in community spread without some measures being put into place to prohibit that or to inhibit it, we have got to put the resources in place. Mr. Dudley, you said that you've got weekly supplies coming in. What is that weekly order that you have anticipated coming in each week?
We usually average about 2,800 to 3,000 a week to keep a good on-hand supply. We're currently working with our local vendor, Quest Labs. So that turnaround time is pretty quick. So we haven't had any challenges keeping those on hand at this time.
That's excellent to hear, because what we've seen is almost a doubling of requests and testing in the last few weeks. And I anticipate that doubling to probably occur if we are not able to put measures in place to mitigate the spread. So I'm anticipating that that conversation needs to happen, because we are going to see additional testing pressures, and we certainly don't want to see that cause someone not to get the test that they need. And thank you very much. I'll stop there.
Mayor Castor, you recognize.
I'm sorry, I failed to put my hand down.
Okay. Mr. Merrill.
Yes, let me just add to that. We are currently working with the state of Florida to get additional supplies and additional support for all of our sites, and we'll get an answer on that pretty quickly by the beginning of next week, because we don't want to fall short, obviously, and we want to take advantage of the state's offer to help ramp up our supplies.
Okay. Mayor Lott, did you have another question?
No, sir. I forgot to put my hand down. Sorry about that.
Okay. All right. Mr. Dudley, thank you very much.
Thank you.
Dr. Holt.
Yes, good afternoon. This is Dr. Holt, Florida Department of Health, Hillsborough County. Today, we're honored to have Dr. Scott Rivkees, the Florida State's Surgeon General. As I've mentioned from the beginning, the Florida Department of Health has an integrated statewide response to COVID-19 through all 67 health departments. Dr. Rivkees and his team has been fully supportive as we all try to accomplish our public health activities, working closely and in collaboration with our local government, medical community, and non-governmental organizations. After that, I will present along with Mr. Wagner, our EPI, and then finally, Dr. Peter Chang from Tampa General will present as requested an update and review of the average length of stay by age on behalf of the four medical systems, and share with us his observations and information from the front lines. Of course, we'll answer questions after each section. Please let me begin by introducing Dr. Scott Rivkees. Dr. Rivkees.
I want to thank everybody for inviting me today. This is a very important conversation to have. I wish to emphasize that COVID-19 still remains a very serious virus. Also wish to really emphasize that this is a virus which is spread person to person by respiratory transmission. And in the absence of preventative antiviral therapies, in the absence of a vaccine, knowing that this is transmitted person to person, really what guides what our approach is in terms of controlling this outbreak. In terms of where we are in the state of Florida today, as of this morning, we had more than 85,000 Floridians who contracted COVID-19. We've had 12,000 individuals who've been in the hospital, and sadly, we've lost more than 3,000 individuals to COVID-19. In terms of testing, how Florida compares to other states, New York has tested 3.1 million, California 2.9 million, and Florida and Texas have each tested about 1.5 million individuals. One of the things we look at very carefully is test result case numbers and also in terms of the percent positivity. And over the past 2 weeks, the percent positivity has increased in Florida. In terms of testing in the state of Florida, we have a number of areas where testing is taking place. We have our drive-through centers. We have our walk-up centers that we've heard about. We're also working with retailers. And also, as was mentioned, we have an integrated county health department system. And each county in the state tests at least 2% or more of the residents in their county. And one of our areas of focus has been to make sure that we're reaching out to all the members within our counties to make sure that we are testing. In terms of where we are nationally, Florida is 8th in the country in terms of the total number of cases. We have about 3,800 cases per million individuals that have been diagnosed, and this places us at 34th in the country. In terms of individuals that we've lost to COVID, which is unfortunate, we've lost 141 individuals per million residents of Florida, which nationally places at 27. Over the past 14 days, we've actually seen a decrease in mortality in the state from an average of 1.6 deaths per million individuals 2 weeks ago to 1.4, which is a decrease of 12.5%. Over the same period of time, there has been about a 10% increase in the number of individuals who have been hospitalized. From the beginning, we have really viewed this as really a very aggressive virus and have had a 5-point plan addressing this, which is we call our STEPS plan, STEPS. In terms of S, the first one stands for social distancing. As I mentioned in the very beginning, this is a respiratory transmitted virus, and this really guides our mitigation measures. In terms of things that have been shown to be effective, scientifically proven, wearing a mask plays a major role. Wearing a mask will stop the spread of this virus in the event that an individual is symptomatic or asymptomatic. We also know that individuals over the 2 days before they develop symptoms for COVID-19 can actually shed very high levels of viral particles. Typically, with the spoken breath, viral particles can go 3 feet, with a cough, a sneeze, up to 6 feet. And this can be markedly reduced by wearing a mask. Also, there is evidence from the healthcare field that wearing a mask actually can decrease one's risk of getting COVID-19. The state of Florida was fortunate to have gotten about 20 million masks from the federal government a few weeks ago. And as of this morning, we have pushed out 17 million masks throughout the state. These have been distributed to our county health departments and to any group which wishes them. So if there are any groups on this phone that wishes to get masks that we have not reached, please reach the county health department. We talk about the importance of hand washing, and the reason this is that if one gets COVID on their hands and then touches a surface, this can potentially be infected. So this is why after frequent hand washing is important, and if soap and water are not available, hand sanitizer with 60% alcohol should be used regularly. We talk about 6-foot spacing and avoiding large crowds. The 6-foot spacing, again, goes to the biology of this virus, a respiratory transmission, person to person within a 6-foot radius. In terms of crowds, one of the best ways to avoid COVID-19 is to avoid crowds. And many of these measures, which I talked about, create the foundation of the guidelines for phase 1 and phase 2 reopening strategies. In terms of testing, this has been a very major priority of the state in terms of increasing testing as much as we can. As I mentioned, as of this morning, we've tested more than 1.5 million individuals. We've had drive-through centers, walk-up sites, working with local businesses to increase testing capacity is some of the things that we have heard about on the call today. Testing is extraordinarily important because this also guides one of our important mitigation strategies, which is contact tracing. If an individual is identified as having COVID-19, we will contact that individual, identify who their immediate contacts are, and have those individuals isolate. Again, a respiratory transmitted virus where we try to stop the cycle of transmission. And this has been from the very beginning a very important priority of ours, and we are continuing this. Next, in terms of protection of the elderly and individuals who are medically vulnerable, this virus heaps its fury on individuals older than 65 years of age and progressively more the older one is, also with individuals with underlying medical conditions. This is why very early on we put protocols and procedures in place to try to keep COVID out of our nursing homes and assisted living facilities. This is why we have also messaged for individuals in the community who are older than 65 years of age, those with underlying medical conditions, to avoid going in public places, and if they do, continue to exercise precaution with this. When we look at the individuals who have lost their lives to COVID-19 in the state of Florida, 86% of these individuals are 65 years of age and older. Also in relationship to testing, one of the things that we have noticed over the past several weeks is that there has been a change in terms of the individuals who are testing positive for COVID in the community. At the present time, when we look at the individuals tested day over day, probably 5% or less are 75 years of age and older. However, we're finding the majority of the individuals who are now testing positive are between 15 and 35 years of age, also individuals in the 35 to 44 age group. So an overall age for new cases being in the mid-30s. And this is important in terms of, as we think of strategies to stop the spread of COVID in terms of populations that we need to continue to reach. We have recently completed testing on more than 150,000 individuals who are in nursing homes and assisted living facilities, and the overall positivity rate for individuals we've tested there is less than 2%. We've also worked to make sure that we support our hospital and give them the resources that they need. This includes personal protective equipment, and then also the antiviral medication remdesivir. This medication has been proven to be effective. There are other strategies that hospitals are using, including a COVID convalescent plasma. And as we've looked at the data over the past several weeks, one of the things that we actually find is that the mortality for COVID-19 has gone down. One of the other things that we also notice in conversations I've had with hospital executives is that we're also seeing younger individuals who are in the hospital compared to before. And the last part of the STEPS plan is stopping the introduction. And this really involves stopping the introduction of COVID-19 into our nursing homes, assisted living facilities, where if COVID-19 is present, it can really have a major effect on different, it can have certainly a major effect on individuals' underlying medical conditions and those individuals who are older than 65 years of age. And I participate in a number of series of calls for the Healthcare Association, home-based community care groups, emphasizing how we can continue to support them in terms of trying to keep COVID away from special members of our society. So again, I very much thank everybody for what you're doing in terms of trying to keep COVID, trying to mitigate the effects of COVID-19 in Hillsborough County, and want to also recognize the tremendous efforts of the Hillsborough County Department of Health, led by Dr. Holt. This team has been working night and day as we are addressing COVID-19. Thank you.
Thank you, Dr. Rivkees. This is Commissioner Miller, Chairman of the EPG. We do have some questions, if you don't mind. Will that be okay?
Yes, sir.
Okay. Mayor Castro, you recognize.
Thank you, Chair, and thank you, Dr. Rivkees, for your service. The supplies and the testing centers here in Hillsborough County. As you know, we were recognized here in Hillsborough County in the Tampa Bay area as being #1, crushing the curve. And now it looks like we're replacing that with #1 in the number of positive cases. If not already, will be over 5,000 here in short order. So I appreciate your endorsement of wearing masks and the effectiveness of masks as well. And I hope that that is something that we can get to here in Hillsborough in short order. I also have one question, and that is, I saw a newspaper article the other day that indicated that it wasn't mandatory for mask wearing at the Department of Health. And so I would question why there would be a mandatory wearing like we have in all medical facilities, that we wouldn't have that same requirement at a Department of Health, especially as much as we're relying on them now. And it seems like a, pretty small but mighty group. And I'll stop there.
Yeah, thank you for your question. Again, in terms of wearing masks, this is one of our most effective mitigation strategies that we have. And I will say at many of our health departments, including where I am now, many individuals are wearing masks, particularly if individuals have been in areas where they may have been exposed to COVID-19. It's absolutely imperative. We have very strict screening criteria for being able to get in the facilities where we're currently working. This involves temperature screening, screening for any kinds of symptoms, any kind of risk factors where individuals have been traveling to. And as I mentioned, many individuals currently are wearing masks in the Department of Health, and for individuals with underlying medical conditions, individuals older than 65 years of age, these individuals are being encouraged to telework as well.
Right, I understand that, but we do the same thing here, and we're #1, getting ready to be #1 in the state for the positive. It just seems that, with the description of all of the steps we can take, the most important one is the wearing of a mask, and it seems that the example of the state would be something that everyone could follow. Thank you.
Mayor Ross, you recognize.
Thank you, Commissioner. Dr. Rivkees, this is Andy Ross from the City of Temple. Harris. I thank you very much for taking time out of your schedule to meet with us today. I'm sure we all appreciate it very much. I do have a question regarding contact tracing, and maybe you can help me determine what's going on at the state level. Here locally, we've had a lot of difficulty trying to get any actionable information as a result of this contact tracing. Obviously, a lot of our cases you can chalk up to the context of healthcare, which really you can take those cases out because that really doesn't tell us much. But of all the remaining cases, there seems to be no pattern at all. People are getting infected, and our data set has grown, unfortunately, so large that that's just really almost impossible for me to believe that you can have 4,000 of anything and not have some patterns and commonalities and points of convergence. I mean, it seems almost statistically impossible that there wouldn't be some patterns. And I guess I struggle with that because as a group here responsible for creating public policy, I think all of us are well intended. We all want to do the best we can, but we have really almost no actionable information to go on here in terms of specifically where are people getting infected. Certainly, there has to be some behaviors that are more risky than others. I mean, I'd like to see things like 10% of these people have, for instance, flown on a commercial flight, or 50% of them have been to a restaurant, or 30% of them have ridden in public transportation. There's got to be something. And if we had this type of information, it would be much easier for us to make informed and collective decisions here. Is there anything you can help us on a statewide level with that? Are you seeing patterns in other parts of the state that maybe you can shed some light on?
Yeah, thank you for your comment, Mr. Ross. So first, in terms of contact tracing, it identifies a number of different areas where individuals will end up getting COVID-19. Sometimes they're related to household outbreaks. Sometimes it's related to the workplace. So they're, with contact tracing taking on at such a broad level, there are many, many, many instances where we can identify it back to specific circumstances. But to your broader point, what are the common themes? So a risk for getting COVID-19, it really has to do with exposure to an individual who is COVID-19 within 6 feet for more than 10 minutes. So getting back to the common things that you're asking about, it avoids, as I mentioned in the beginning, one of the best ways to avoid COVID-19 is to avoid crowds. Certainly avoid individuals who are ill, coughing, sneezing. And for those of us, we all play a role. We all have a personal responsibility to lower the spread of COVID-19 in our communities. If we are ill, we certainly should avoid going in public and make sure that we get tested. We certainly should avoid being in contact with individuals who are older than 65 or have underlying medical conditions. We should avoid going to work. So as far as common themes, avoid crowds, make sure we practice 6-foot spacing. And again, the key is more than 10 minutes within 6 feet, and this risk can be markedly reduced with the wearing of face masks. Thank you, sir.
Okay, Commissioner Overman, you recognize.
Thank you, Chair. Thank you, Dr. Rivkees, for being here. I really appreciate all the information you shared with us. And to follow up on Mayor Ross's question, we have heard in the past, and I don't know if that's the case now, that the more testing positives that we have, the greater need we have for contact tracing to inform that individual along with those around them that they have the risk of exposure. I think I've understood us to say that we are quite limited in the amount of contact tracers that we have in terms of resourcing and getting that done. And now that we've seen an increase, how can we get help in this area? Training people to do this is it doesn't happen overnight. And I know Dr. Holt is doing a fabulous job of juggling a million things. But how would Hillsborough County acquire contact tracing support from the state in the event that we are, well, given that we are where we are, given as far as a widespread exposure? And then secondarily, if we have restaurants open and people aren't wearing face coverings and staff is not wearing face coverings, I don't know how many people eat in 10 minutes, but I would see that that would be a risk factor that needs to be addressed if, in fact, to Mr. Mayor Ross's point, if, in fact, it seems as though those kinds of exposures are actually causing the spread that we're experiencing. And I'll stop there.
Yeah, thank you for your comments, Commissioner. So first of all, we need to make sure that if individuals aren't wearing face masks, that they have them available. And as I mentioned, the state of Florida, we had received 20 million face masks, and we pushed out 17 million to the local communities. So if individuals are in need, Dr. Holt and his team will be happy to provide them as well. As far as your other point, in terms of contact tracing, back in March, when we saw COVID-19 coming, we took plans to actually expand our contact tracing teams. We had partnered with schools of public health and hired several hundred individuals from schools of public health to join our workforce. At the present time, we have more than 1,600 individuals directly employed by the Department of Health, and we also have continued to add to our workforce, recently signing a contract with a group that provides contact tracing. And above and beyond that, we are also adding on top of that to make sure that we are keeping up with the increased demand. We very much appreciate cooperation of the schools of public health, who actually helped identify students and faculty members to aid in this effort, and we continue to build upon that. We have regular calls with the county health departments many times during the week. If health departments, whether it's Hillsborough County or another county, need support in contact tracing, having an integrated system allows us the flexibility to deploy contact tracers who may be in one particular county where the case number is relatively lower to support that in another county.
That's terrific. Thank you very much for your answers. And the question associated with close quarters. We have a very large population of restaurants that are not requiring their staff to wear face coverings. And that practice would appear to be a challenge to our reduction of community spread. Would you agree?
Education is the key for everything that we are talking about, and all the comments that I have heard earlier. The more that we understand how COVID-19 is spread, the more that we can stop its spread. And as one of the comments was made earlier, each of us have a responsibility in helping to slow the spread of COVID-19. Our communications team at the Department of Health has put together many, many, many infographics about what best practices are. CDC also has extensive guidelines as well. So if there are special circumstances where you'd like us to help provide educational material, Dr. Holt and his terrific team there will be happy to make them available.
Mr. Merrill, you recognize.
Thank you, Mr. Chair. I just also wanted to add that I authorized last week or earlier this week $750,000 to Dr. Holt to hire additional contact tracers and set up a more extensive system here. So did that from our CARES Act money. So we're helping to supplement here locally for our own community.
Thank you very much.
Mayor Lott, you recognize. Lott.
Thank you. First of all, Dr. Rivkees, I want to thank you for being here today, and it's great to have the Florida Surgeon General on hand for information and comments. There's something I've been wanting to ask for a while now, because it's something I'm seeing more and more and more of, is individuals that will come down with COVID-19 and they're living in an apartment or home with their roommate, their loved one, and the other ones in the house do not get the COVID-19, even though they're living together. So can you kind of explain that a little bit to me, how, living in close quarters like that, you can have two people living in the same house, in the same apartment, and only one of them gets it without the other one, and other situations where just you can be in a restaurant and be near someone and get it. How does that occur?
Yeah. Thank you for your question, Mayor. So first of all, it's possible that they may have acquired COVID-19, but they're not symptomatic. This is a virus that we continue to learn about more and more each day. Up to 30 to 40% of individuals with COVID-19 may not manifest symptoms. And that's particularly true in individuals who are relatively younger. So it's possible that if somebody is in close contact with another individual, that they have acquired COVID-19 but may not manifest symptoms. So this is why, as part of the contact tracing with Dr. Holt and his team, and also first, I want to thank your county for providing support from the CARES Act dollars for allowing us to get additional contact tracers. So this is why, if an individual is found to have COVID-19 and somebody has been in close contact with them, meaning more than 10 minutes within 6 feet, those individuals are asked to isolate for 14 days and monitor their symptoms, and certainly avoid individuals who are elderly. And then there also will be some individuals who will not get COVID-19. There are other examples where individuals were in tight quarters and some individuals developed it and some individuals did not. This has to do with part of the biological variability that we have. But I wish to emphasize that this remains a highly infectious virus. There are many examples of how this spreads. And then also individuals who have it sometimes will breathe out different levels of virus. There's some individuals who are referred to as super spreaders, where these individuals can spread it to 10 to 20 individuals versus the typical individual who would transmit this to 2 to 4 individuals.
Okay. Dr. Rivkees, I see no more questions. Thank you very much for your presentation. We appreciate you being able to take the time out of your busy schedule to be with us today. Thank you very much and stay safe.
Yeah, thank you, sir. And I thank everybody on your call for your insightful questions. And as mentioned, want to do everything we can to support and again, recognize the tremendous efforts of Dr. Holt and his team and all of you in Hillsborough County. Thank you.
Thank you. Dr. Holt.
Yes, sir. Next, we'll do our epidemiology presentation. We're going to modify it a little bit. Kevin and I are going to do this jointly. So, Kevin, can you start, please, with the first slide, and let me know when it's up.
Go ahead, sir. It's up.
Okay, thanks. Again, this is our standard first slide. As you'll note, 4,272 cases as of yesterday. That's an increase of 1,098 since last Thursday. Kevin, you want to take it from there?
Yes, generally, as you see on this slide one, we tested equivalent to about 6% of the total population through yesterday on June 17th. of the 4,210 cases, it still shows that 54 to 46% female to male split. But again, that was yesterday. Looking at the FDOH numbers today, it's nearly 4,600. So that's another 200 to 300 cases. But that's, again, what's represented is the information as of yesterday. Next slide, Dr. Holt.
Yeah, so again, this is our cases. We look at all since the to date, and we look at the age. Again, not a lot of change, but there has the most recent shift in our new cases being in the younger. It's starting to bump up that left side a little bit. Kevin, you want to go through any more?
No, of course, this aligns with Dr. Rivkees just said that we're seeing more in the 15 to 24 and 25 to 34 positivity range. Currently, when we look at this range from a whole, those two age ranges, account for nearly 35, 37% of the total caseload. So again, it's 15 to 24, or 34 are quite high and rising in the county. And that's all, sir.
And I think that's reflected when we look at it on our 14-day average. You've seen our plan right now is to report this weekly, but we're going to now look at it on 7-day averages so we can keep as current as we can. Kevin?
Again, the 0 to 34 of age, again, on the 14-day surveillance as of June 17th, accounted for 52% of the total positive cases in that 14-day range. So again, as Dr. Holt indicated, we will move this to a 7-day for currency. And that's all, sir.
And this is a new slide, this next one. It's a new slide. I want to thank and the courtesy of Dr. John Curran. He's the chair of the Hillsborough County Healthcare Advisory Board. And what this does is really show the number, individual cases and what it is the actual numbers rather than the percentage. Kevin?
Yeah, again, this is the 10-day average of cases. So again, on the average per day, on the 25 to 34 range, there's about 47 cases per day in that age group. So again, we'll keep this up on a 7-day average, as Dr. Holt indicated. Again, this is the average, not any percentages. I know people want to see specific numbers. So again, on an average, it's about 46.5 per day, 26.5 on 15 to 24, and almost 25 a day on the 35 to 34. That's all. Next slide.
And this is the one we track with our 14-day trajectory. And as Kevin mentioned, this does not include the one that was reported this morning, which is also another significantly high number. Again, it shows that our upward trend is sustained. I would note that the slope to the far right is beginning to show more, it's becoming more steep. We intend to continue to show this every Monday and Thursday. Kevin, do you want to take it from there?
I think the only difference with regards to the rolling 14-day average that's indicated, it's 134 cases per day compared to 7 days ago. Last Thursday, it was 109. Dr. Holt pointed that out in our conversations earlier.
This is Commissioner Miller. The number you have at the very end there, 244, that was of yesterday, right?
The number of cases yesterday, today, yes. Mm-hmm. Yes.
And today we're reporting 337. So it's almost 100 more cases.
Yes, sir. That's about right, Commissioner. That's correct, sir.
Okay.
Next slide, Dr. Holt.
Yeah, number 7. This shows how much testing we're doing. Again, we're seeing an upward trend, nearing 2,000 a day, which is about 90% of what our Dr. Lockwood had said is our target. Again, I want to recognize Mr. Dudley and his team, but also our private sector partners for their efforts on testing. Kevin?
I have nothing. The comments, again, we're trying to get up to the 2250, sir.
This next is our 14-day positivity, and this is one of the important ones we watch. it is, of all the tests we do, how many of them are coming positive on a 14-day rolling average. Again, as you note, our trends are continuing to increase. Again, we would definitely prefer this to be decreasing as we do more and more testing. So the fact that we're doing more testing, but yet seeing our positivity rate continue to increase is concerning. I'll stop there, Kevin.
No, I have nothing, sir. Next slide.
Before we talk about the next slide, we usually put our deaths, we put the number of deaths that we've been tracking. And last Monday, we tried to present it in a different manner. It does not really reflect, I think, what Kevin and I looking at it. We're concerned about the questions about where our data sources are. And actually, I had a conversation with Dr. Devers, our medical examiner. She's presented yesterday. And so after talking with her, we're going to get together, the three of us, and try to find out a better source to more accurately present. I would note that she did share some observations and some concerns that she noted that in this current week, and we've had a number of deaths, very different type or pattern or situation is a better term. They're not really associated with long-term care. 4 to 5 of them, while they are quite elderly, they have rarely left the house, and at least 2 were known to be exposed and therefore infected by family members. So and he certainly did not catch it there either. So we're going to figure out a better way to accurately reflect this in metric. So moving on, this next one is our emergency room surveillance. It reflects the number of people coming in with COVID-like illnesses. As you can see, there's a steady trend. I think anecdotally, and perhaps Dr. Chang may mention, talking and listening to my emergency room colleagues, they're seeing actually large numbers and have even, in some cases, had to open up their bypass or their tents so they can divert those that are ill or seeking testing, which they haven't actually.
I don't think we have that slide. I don't think we have that slide. I think you're still on another slide.
Commissioner, no, it should be the ED visits with COVID-like illness.
All right. Okay. All right.
That's the slide, sir.
All right.
Oh, I only have hospital.
Be slide number 9.
ED visits with COVID-like illness, Hillsborough County. That's the slide we're on.
Yes, sir. Yes, Commissioner.
Okay. All right. Go ahead. I'm sorry.
My apologies. I'll mention the titles. The number 10 slide is a new slide that we're going to begin to use, and it really tracks the daily admissions of our COVID patients. It really reflects, I think, a more immediate and measure real-time data about what's going on. The total numbers are low, but as you can see, there was a spike of 50 on the 16th, and so Dr. Chang could also probably help us as he talks about his average length of stay and what they're seeing with that. So we're going to continue this to present on our Mondays and Thursdays. Next slide, Kevin.
Yes, sir.
This is the slide that you've seen, but actually, thanks to Kevin, I think he came up with a better way to project it. The data is looking at the amount, the volume, the impact that the COVID-19 patients are having, and the availability, occupancy of beds, ICU, and regular beds, ICU, and ventilators. Kevin, I'll let you go through the actual numbers. Essentially, we have a total of 146 as of reported here, hospitalized. We had 131 last Thursday, a week ago. Kevin?
Thank you, Dr. Holt. Again, I've rechanged this to, because we are adding more data points to it, I wanted to try to streamline the process from a viewing. So top slide number 1, again, we're looking at total bed capacity in the system. On average, there's 4,400 beds in the system. On June 16th, the far right-hand side of slide 1, 2,900 beds were used for various reasons. 1,400 were available, about 30%. So we added the percentage on the bottom so you can clearly see the rolling percentage of every kind of day. Slide 2, or number 2, on the right-hand side, taking those 2,900 beds that were occupied, we looked at the number that were COVID and non-COVID. So the non-COVID were 2,700, nearly 2,800. COVID beds used, as Dr. Holt indicated, 146, or about 5% of the used beds. Again, that's going to be an indicator going forward, that line at the bottom, the orange line, of how many used beds, to see if that percentage, right now it's between 4 and 5%. Does it decrease? Does it increase? Does the total bed used for COVID increases? So that one will be a significant indicator. Slide number 3 in the bottom left-hand side, we're speaking about the ICU. 413 is the general available beds for capacity in the ICU. On June 16th, 320 were used for non-COVID events. And then we saw 53, the green, 40 were used for COVID, and then 53 were not. So again, not a significant capacity of available ICU beds. Again, but COVID is only making up 30 to 40 at this time. Again, various other ICU bed utilization. Again, we want to show the total bed, the total utilization, and available capacity in the green. And then what's COVID being used with this slide. We flip this over to number 4, same concept with the vents. 745 on average is the available beds. 628 were available, not being used on June 14th. And then there was 18 being used for COVID at that time. So again, not a high COVID utilization, and then 117 were used for other than COVID. So again, we're trying to look at the complete hospital system as it's self-reported by the hospitals on a day or every other day report. Next slide.
Thank you, Kevin. And that, again, I think Dr. Chang will help us, as requested, give us some more. This is the slide that we've been talking about from about a week ago that I wanted to work with Kevin and look at. It is cases by zip code. So bear with me as I walk you through it. We chose to sort zip codes, look at zip codes by what's called an incidence rate. And essentially it's what's the number of new cases that have occurred in this 2-week time frame divided by the population. So as you can see, zip code 33602 has the highest incidence per 1,000 of their population. If we had looked at it just by the total number of cases per zip code, that zip code would have ranked, if you will, 9th. And so that's clearly because some of our zip codes are close to 55,000. Others are almost or below 10,000. The top 10 that's displayed here represent almost 50% of our cases for this time period. Our population of about 300,000 or 20%. So clearly this is a disproportionate number per residents. But it's note that while our cases are reported where they live, doesn't necessarily mean where they're infected. But clearly, as we've talked a lot about contract tracing, the one thing we do know, if we do know where the people are infected, it is around their home, close friends. So this does have some correlation. Those that are outside of their house, if they were infected, again, I think as Dr. Rivkees talked about it, the greatest risk is where you spend most of your time, especially time around people, so workplace, or it's where you spend a lot of time around a lot of people. and especially where it's hard to maintain 6 feet distance and social distancing. And again, as noted and repeated by Surgeon General or Governor DeSantis, this is when masks play a useful role. I want to comment about what we're doing with this information. Targeting, speaking of masks, we are going to work with the Department of the county, Mr. Dudley and his team. So far, the Florida Department of Health, we've distributed about 55,000 using our network of civic association partners, non-governmental examples of Healthy Start Coalition, the Rampala Downtown District, but especially our faith-based organizations. Again, we've distributed 55,000. We have 130,000 more that have already been claimed, and actually we have a request for the 100 and even up to 150. So we're going to continue to ask from our Department of Health supplies. Dr. Rivkees talked about, and Mr. Dudley and mentioned, receiving 500,000. My understanding is that the plan right now is to distribute this into the local governments and jurisdictions, City of Tampa, Temple Terrace, Plant City, throughout the county. And there's going to be a variety of strategies on how to get them in the hands of those people, including individuals, organizations, and businesses. Zip code, this zip code will be used to emphasize or to prioritize that distribution. Public service announcements, developing, looking at how to reach people, particularly the younger people in these zip codes. But certainly that's a countywide message. But how can we get the message out locally and directly to these communities? Just a reminder, COVID-19, as Dr. Rivkees, and we've talked about it, I think about it, it's like playing a game of tag. It's just you do not want to be it. So be selective on who's in your circle and whose circle you're in. Keep that 6-foot distance, wear mask if you can't, especially avoid or limit around closed spaces, crowds, especially if they're loud. The contact tracing is going to be focused again on this area, and also with our emphasis on getting tested. With the sudden surge in our cases that we've seen, our resources are stressed. And as Mr. Merrill and working with Ms. Wise, I'm very thankful for they were provided us additional money. This will allow us to hire staff that are ground-based, so it's teams that we can deploy and are not vulnerable to perhaps being redeployed, like the state has currently given us a lot of support, but we know that may not be sustainable. Despite this additional money, we are going to continue to ask, and I expect to receive full support from the state. Just information on our contact tracing, besides, again, our household contacts, close friends, which we can account for about 1/3 of our cases. We are seeing, as Dr. Rivkees talked about, what the rest of the state is seeing, enhanced or increased number of work-related, could be an office or restaurant workers, or particularly concerning is healthcare workers. We know they're not infected at work, but they are critical workers. We've seen examples of migrant communities, and Mayor Lott was right on, apartments with particularly groups of where the young are living. When we investigate and talk to a business that has had an infected employee, again, I would emphasize in most cases, at least we believe, they were infected not at work, but outside of work. We then focus on, are they able to keep their distance from other staff or their patrons? If all staff are wearing masks or were wearing masks at the time, and the person was asymptomatic at the time they worked, then those members that were team members, coworkers that were wearing a mask, can and will be allowed to continue to work. But if you're not wearing a mask, we advise those employees to self-quarantine. Deep cleaning, once we identify it, is essentially the standard, and look at and modify any of their business practices to get enhanced social distance. Our priority is to get them safely back to business. With that, I will close by saying, I think clearly we're seeing evidence of increasing community-based transmission. And as Governor DeSantis has said, we're not going to close or roll back, but if we continue to see the increase, then we need, we'll reach a higher enough level that it's going to be much harder to continue as we proceed to safely open schools and all safe business continuing. So we also will increase a greater exposure risk to our elderly. So one more time, I'm not going to repeat the specific advice, but I know our public, our community know what to do. And at this critical time, it's essential that we do it. Commissioner, I'll stop there.
Thank you, Dr. Holt. The thing that gets me in my district the most is that those numbers you put up there, I counted just about half of those or even more in the district that I represent, which is the poorest part of this county, which really, really disturbs me, really, really concerns me. I mean, I saw those numbers and looked at those districts and really, really concerns me. And we're sitting here now saying, do we wear a mask or do not wear a mask? Commissioner Overman, you recognize.
Thank you. Could you go back to slide 8 for me, please? I just want to make sure I'm reading this correctly. When we had started this whole process, there was a plan for reopening, and there was a requirement to move from one phase to another of a either stable or flat 14-day rolling average. And if I'm looking at this correctly, since our first phase opening on May 4th, we were actually seeing a decline until, although the trend looks upward because of where we are now, we were seeing a decline until about May 21st or so. Is that correct, Kevin? Am I reading that correctly?
Yes.
Okay, but
yes, Commissioner, that's correct.
Okay, so midterm between first phase and second phase, we saw a change in that 14 rolling average. So maybe around the 21st of May. Since then, we've seen an increasing 14-day rolling average at a rate that's increasing also. Is that correct?
Yes, Commissioner.
Okay, so if our rule is we should consider our 14-day average for reopening phases, and we got to phase 2 and we opened up additional steps at a local level, we really haven't been paying any attention to that guidance. Is that correct?
Threw them under the bus.
No, I don't. And we're all in this where we implement the phase-ins as where we can. The state does give us some, but we actually have to pay attention to that rule that we open phases based on 14 rolling day averages. And at this point, even if we looked at the general number versus the linear number, we were still increasing since the mid-May. So my question is, rolling back, we talked about dialing up and back, and we've done that over the time period. But if we were to go back to, reopening stage 1, we would actually find ourselves more effective in actually reducing it. But I don't know if anybody would have any desire to do that. But the guidance was that we were to have a flat or declining 14 rolling average. And we haven't seen that since mid-May. So I'm just asking, what steps can we take to return to a flattening of our growth rate? If you can answer that question.
Commissioner Overman, I think that what you're asking right now is not the question that Mr. Wagner can answer. I think that has to be a question that Ms. Beck will have to answer, because we have to adhere to what the governor's executive order says. Am I right, Ms. Beck?
Yes, sir, Commissioner.
All right.
Am I correct?
Yes, sir.
That's where we are, Commissioner Overman. I mean, you can ask that of Dr. Holt and Mr. Wagner, but the bottom line is that local jurisdictions have to adhere to what the governor's executive order is going to say. I understand what you're saying wholeheartedly, but the executive order is the one we have to adhere to.
Well, I understand that too. And the goal, what I'm asking is, I wanted to make sure I was reading the numbers that Kevin Wagner had shown us. And it does indicate that we have the responsibility of following that 14-day average and implementing some portions of the governor's orders at a local level. We can't do all of them, but we do have the responsibility of meeting that standard. And I was just making sure I understood the numbers correctly to suggest that we do have some areas that we should consider. And I was wanting to find out if there was an option or which reopening processes that we chose to adopt in the second phase that we have the ability to adjust if we wanted to reduce the spread.
I think that question needs to be asked by Ms. Beck, because she's the one that reviews those documents, those executive orders from the governor. Do you want her to answer that?
That would be great. If she wants to do that later, that's an option if we hear more reports, but I think it's something I think we do need to address. Thank you.
Beck, you want to address that now or wait till your turn?
I can wait my turn and also just say that we do have some options here, but we also have to be consistent with the governor's order.
Okay, we'll wait till you call. I'll call on your at your portion of the agenda.
Okay, thank you.
Good question, Commissioner Overman, but yeah, I just think you were directed at the wrong person.
Understood. Thank you.
Yeah. Mayor Castro, recognized.
Thank you, sir. This presentation, Dr. Holt talked about the increase in the number of positive cases as being concerning. I would define it as alarming. And I would also submit that it probably is an underestimation of the true picture of positive cases out in our community. And specifically for our city, city of Tampa, which is the most densely populated, we have 2/3 of the cases in the county, positive cases in our community. And there's been a 300% increase in the positive cases since June 4th. And that's till yesterday, the 17th. So, and people can play with those stats. You can make those numbers say whatever you want, but it's the positivity ratio. It's the number of tests based on how many of those are positive. And it's difficult to be pinpoint accurate because we don't get those test results back in a timely fashion, or immediately, I should say. And also we have a number of private facilities that are doing the testing as well. So I believe that we are all looking out for the best interest of our community and for the community's health. And that is both the physical health and the economic health. And if we don't want to have a downturn, go backwards, as Commissioner Overman just alluded to phase back instead of forward, we are going to have to take action. And the only action that has been mentioned by Dr. Rivkees, by Dr. Holt, by all of the heads of the hospitals, by Dr. Lakshmi, by all of the medical personnel, the only way to stop this is to wear a mask. That is the only way. And the fact that our own health department doesn't even have a requirement to wear a mask is just unconscionable to me. And the community is looking at us as the leaders, and they're looking for us to give them direction. Also, a lot of the businesses are looking to us to give them direction because they're in the hospitality field, and they want to be able to tell their customers that this is a requirement that you wear a mask. And we have the ability to provide them and we have the ability to put an order in place to wear the masks. And I think the longer that we wait on this situation, it's not going to get any better with time. There's no doubt about that. And also, lastly, I'll land the plane here. With the death that Dr. Holt just talked about, that I hadn't heard that information, but that's indicative of the young people, the 25 to 34 that are bringing it home to individuals. So now we can say, well, the majority of those cases are in young people. They're young, they're strong, they're virulent, they'll get through this, but they're going to take it home to their parents, to their grandparents, and we're going to see a skyrocket in those deaths. And I, for one, don't want to wait until we get past the point of no return. Thank you, sir.
Okay, Dr. Holt, was there anything further you need to bring forth?
No, sir. That concludes my presentation.
Okay, thank you very much. Ms. Liana Lopez and Dr. Eisenberg.
Liana, do you want to say anything first? Go ahead.
No, I was just going to say this is Liana Lopez, Chief Communications Administrator for Hillsborough County, and Dr. Eisenberg is going to lead us through the presentation, and I will be available for questions. And then following this topic, if you'd like me to address the call center, I can.
Commissioner, this is Dr. Holt. I'm so sorry. I forgot Dr. Chang.
Oh, right.
I'm so sorry.
Right.
Okay, all right.
Yeah,
we'll come back, Dr. Eisenberg and Ms. Lopez.
Not a problem.
Yes, Dr. Chang.
Hi, Mr. Wagner. Can you go ahead and put up my slides, please? So the EPG on Monday had requested that I come and present some hospital data around the demographic that we're seeing that's being admitted to Tampa General Hospital, in addition to the length of stay. So, some very interesting results as the slides get posted, if we can get them up. If not, I'll kind of talk through them. What we're seeing present to our emergency department, the peak is in concordance with the data that we're seeing from the county and the state, with the 25 to 34-year-old age group as the highest demographic and in regards to numbers. I could share my screen. I do have the slides up if I could do that. Am I able to do that?
Sir, I don't have them.
Okay. Well, am I able to share my screen?
Yes, if you can, yeah.
Mr. Brewer, could you assist him, please?
He doesn't have them. He doesn't have it.
Doesn't have them.
I don't have the presentation, but
so
you'll
see him coming up.
Go ahead.
Yes, Dr. Chang, we can see him now.
All right, great. So what you're looking at right now is the age distribution by COVID-19 cases by age. So that 25 to 34 age bracket is the one that we're seeing the most positives in our ED. But I want you to look very closely at a couple of things. The 75 and plus, you see numbers of around 20 to each of those. When we look at the total admissions, that means that 100% of patients that presented in this age bracket were admitted to the hospital, and 50% of those patients went to the ICU. So just keep that in mind as you're looking at the data. As we look at where the greatest number of admissions occurs, it's in that 55 to 74 age bracket. And to go with what was just mentioned by Mayor Castor earlier, this is what we're starting to see as the trend inside of the hospital. We're seeing the spike in the younger folks, but we're also seeing a spike in the admissions of their aunts, uncles, and parents. As we move down to our next slide here, this is the length of stay of all patients. And then over on the right here, you have the length of stay of ICU patients. So these are actually individual patient counts you see to your left. So you can see if normal patients are admitted non-ICU, positive for COVID-19, they're staying anywhere between 1 and 9 days. But you can see, as again, this is all admissions, the ICU numbers here are the ones that stay much, much longer. This is looking at our ICU only patients, where you see our counts here, and the majority of patients, we do have some shorter stay ICU patients. These are mainly quick observations, mainly in that younger population that they turn the corner and do well and can be discharged. But the majority of patients right here are the ones that are staying upwards of our longest length of stay was 48 days from a COVID treatment here at the hospital. And I think when you start to look at the numbers, that's one thing. And I just presented a whole bunch of numbers to you, but I'd like to maybe talk through 2 or 3 cases and then finish up with some of the trends and volumes that we're seeing in the last week. So we had a 28-year-old mom who recently delivered at another hospital who came here for ECMO. ECMO is a machine that basically oxygenates your blood for you. She spent 3 weeks on ECMO here at TGH and actually recovered and returned to rehab to her new baby. We have a 47-year-old TGH team member with her only comorbidity is hypertension, and she's currently on a ventilator. So those are the things that, although we can talk about, the 75 and plus community, we're really seeing the spike in admissions in that age group from around 40 to 60. And that's really taking up the capacity here in our hospital is coming from those age groups. In the last 3 days at the hospital, we've had double-digit admissions from COVID-19 into both our ICUs and acute care areas. We had, as Dr. Holt mentioned, we opened up our alternative care site, saw 36 patients on Tuesday and 88 patients through that facility yesterday, with a total of 32 positives identified across all of our EDs. So these are kind of the numbers that we're seeing. Yes, we're not seeing that immediate spike in admissions that's overwhelming the health system. That's not where we're at right now. We are seeing an increase in the numbers, but if the number of new cases that were represented by per day are continuing to increase, I think the hospital systems will only continue to see that increase here in regards to admissions. Thank you, Chairman.
Thank you, Dr. Chang. We appreciate it very much. I'm trying to see if we have any questions for you. Hold on. Ms. Snively, you recognize.
Thank you, Mr. Chair. And thank you, Dr. Chang, for presenting that information. And thank you, Dr. Holt, for reaching out to some of our healthcare partners to get some of that data that we requested at our last EPG. And I thank TGH for sharing that information. I was wondering, maybe Dr. Holt can answer where we are on the progress of maybe getting some information from our additional partners in healthcare throughout Hillsborough County. This is a great snapshot from TGH, but I know that there are some other facilities and partners that we have that I would love to see the same type of information. I did get some from HCA. Reached out because I sit on the board for an HCA hospital, so I was able to get some information from HCA, which is actually pretty similar to TGH's information. The average day is about 9.2 days per patients being admitted, but I'd love to see if we could get some additional information, if it's similar or if it's not similar, from our other partners. So thank you again for that information, Dr. Chang, very helpful.
Really quickly, Ms. Snively, we do have a collaborative we formed amongst the 4 big hospital systems, HCA, Advent, Daycare, and TGH, where we looked at 51 hospitals that are on the West Coast region, and we've gone in the last 10 days from an average census of COVID positive patients of around 380 to this morning was 562. So that's across the system, just kind of a broad brush stroke, but not that granular length of stay data that you're asking.
Thank you for that.
Ms. Snively, this is Dr. Holt. I will continue to request. I know some of them were working. I was getting emails from the Beck. I actually shared your presentations with my HCA contacts, and so I promise I will keep requesting. I know Dr. Chang had mentioned it took him a little while to get that data, but I'll continue to make the ask.
Thank you, Dr. Holt. And as we discussed in the previous EPG, it's important to understand how the level of or the length of stay can impact the hospital capacities and the projection if we need to take action on that, because that's one of our, obviously one of our most important issues is hospital capacity. And so the more that we can understand how the length of stay and treatment of certain age groups of patients impact hospital capacity, I think the better we can kind of monitor the situation and if we did have to take any type of action. So thank you for that continued information for our group.
Mayor Castro, you recognize.
Thank you, Chair, and thank you, Dr. Chang. I think speaks for the whole group when I say thank you for your efforts and keeping us informed with all this very valuable data. The question that I have is that if you have run the numbers, and if you have, can you share the information on the current trajectory right now? Do you anticipate when the hospitals will reach maximum capacity or possibly be overrun? And same thing with the ICU.
That's a great question, Mayor Castor. So what I'm in the middle of right now is analyzing the length of stay via age group, and then comparing that to the patients that are coming through the door for admission. So that would give me the best predictor, I think, of hospital utilization. So kind of thinking back through it, it's how many patients are coming in, what age groups are they falling in, and generally speaking, how long does that age group spend in the hospital? If we're able to kind of take a general percentage of how many presenting positive patients are being admitted, then I could extrapolate through the hospital capacity. So I'm working through that right now, but it's not, full predictive analytics, but it does help at least try to get us some sense of where the hospital, not only TGH, but our other hospital partners in the county, where we'll be in the upcoming days and weeks.
Okay, and I would just request, Chair, that Dr. Chang, if possible, to provide us with that information on Monday if they have some sort of a window. Clearly, it wouldn't be completely definitive. Thank you.
Okay. Dr. Chang will do that for us. He and Dr. Holt will work together on that. Commissioner Overman, you're recognized.
Thank you, Chair, and thank you, Dr. Chang. I had heard that there was a collaborative that was working together, and I've had some conversations with Dr. Wilson about this particular issue. My concern is the age ranges and the growth rate of those that are coming in, and to again address the contact tracing and Mayor Ross's concerns. You made a statement that got my ear. That was they brought it. The younger people are getting in. They brought it home to their aunt and uncle, or their grandparent, or somebody in the age range. What is that contact information or that source information being shared in our database so that we can work with the communities and workplaces to make sure that they're notified where there is a risk factor? And I know that our contact tracers are doing it, but I would imagine the hospitals are gathering a lot of information that would be valuable. And I just don't know how that information sharing works. Can you help me there? Is he still here? Oh, there he is.
Yeah. Yes. Is that for me or Dr. Holt? I apologize.
I can, because it's actually the information that you're learning as these individuals are admitted and staying in the hospital and determining the source of the exposure.
Yeah, so most of, again, everything is really consistent with what Dr. Holt has mentioned before in regards to the source. It's either related to some sort of event in the community, and then that person comes home, and then immediately some of their family members start showing up. We've actually had couples come in together positive. We've had all the way from a caregiver brings it in and gives it to an elderly person they're taking care of in the home. And then their children get it from coming to visit their elderly parent. And so that's kind of the localized contact tracing we'll do in regards to the patients here at the hospital, but I'd have to defer to Dr. Holt to look at the bigger picture of contact tracing.
Yes, ma'am. This is Dr. Holt. The contact tracing, the information we get from the hospitals is very, very important. Certainly for all those that in their medical record, we do have access to their medical records. So we're able to look in there and find things that give us clues that we also use in addition to talking to people to get, because sometimes, in all honesty, they tell their doctor a little more than sometimes they tell our contact tracers, and that is access. We have access to those because it's a public health need. The patients also that were admitted, in addition to trying to interview their family, sometimes that admission history also gives us lots of clues. And I guess I'll close by saying that one of my invaluable sources is just hearing from them and getting contacted directly or through our epidemiology, through their infection preventionists. And we have a fantastic group of infection preventionists at all the hospitals. They have a group called BAPEC, Bay Area Infection Prevention Group. And, they are historically one of our closest partners for any illness. And so everybody's trying to do their part to answer all the questions that you have about, where's it coming from and where's it going? And I'll stop there.
Thank you. Thank you very much.
Sheriff Chronister, you recognize.
Thank you, Mr. Chair. Quite some time ago, as we began opening up our county and the state, we certainly suspected that the number of cases were going to increase. And at the time of that discussion, there was talk from Dr. Holt and Mr. Dudley about creating a response to hotspots. With this contact tracing and identifying the areas in our community where this is being infected, as we quickly and vastly, I guess, approach a vote that's going to affect our entire county, I guess my question is, why have we not had any type of discussion on directing a response into those neighborhoods?
Yes, sir. Let me try to answer that. This is Dr. Holt. Community-based transmission, it doesn't avail itself very well to contact tracing. The ones that we are able to contact and directly notify the known exposures, the known people, represent a small proportion of the total numbers. And what drives community-based transmission, and even Dr. Rivkees talked about that, we're super spreading. They're not individuals, but events. So one or two people that are in a place where there's a lot of random people that aren't connected and they get infected. So yes, we can find individual churches. We could find individual workplaces. We can even find individual apartments, gatherings, but they do not put the fire out as effectively as if that was the predominant mode of transmission that we were seeing. So as we see more and more of this, our contact tracing becomes less and less effective of suppressing the spread. I hope that makes sense. I'll stop there.
Anything further, Sheriff Cronk?
No, sir. I'm a little confused. I just wondered if we have certain areas in the county where we're seeing this four individuals per 1,000, 4.27. I guess my question is, why wouldn't we prepare a response to go into those areas, those zip codes, and help reduce the community spread there versus something, some type of measure that would infect the entire county?
Oh, well, maybe I apologize. I didn't understand. We absolutely intend to go directly into that neighborhood. But if you were talking about mitigation and limiting your mitigation to a zip code area, it wouldn't stop the virus, because the virus is being exposed. People are getting exposed in a variety of different locations beyond that zip code. So it's not that the virus itself is limited to those zip codes. It is widespread, and it is concentrated in there because some of the local population has characteristics that create higher likelihood of being infected. But applying mitigation efforts to an individual neighborhood, it was used in New York early on, where they basically quarantined something like 100-block radius. But that would be a very drastic situation that I can't even imagine us trying to do. but education, providing masks, enhancing testing, those are our responses to the hot spots, if you will. And I'll stop there.
Thank you, Dr. Holt. I agree. I think zip codes are a good place to start to enhance education on prevention measures. Thank you. Mr. Chair, thank you.
You're welcome, sir. Mayor Ross, you recognize.
Well, thank you, Chair. And I don't want to beat the horse to death, but now I'm confused. I thought I was getting a handle on this, but what I think I just heard Dr. Holt say about the zip codes and how it would be ineffective to address the hotspots, that seems to be in direct contradiction to what Dr. Unash told us several months ago when he was talking about the hotspots. I remember him using the analogy of the fire hose. You have to know where to spray the water, and this is a tool to tell us where to focus our efforts on. And now I guess I'm confused because now I'm hearing that strategy is not valid. So like I said, I don't want to beat the horse to death. I'm not even sure if there's a question in there, but I am now confused about, are hotspots important or are they not?
Yes, sir. And I apologize if I'm confusing the issue. All of the responses that I talked about are mostly designed for containment, but applying mitigation such as requiring a business in this place to do this, or limiting people, requiring masks in a zip code, or some type of, closing parks in one zip code versus another is what I was kind of referring to. We can't put out the fire through those methods just in a zip code, but what we can do is very much target the education. We do distribute masks disproportionately in that area. We find people locally to be the communicators to their neighbors, and so they understand that the risk is at this time relatively greater in their neighborhood, but it's still, they can get infected anywhere if they happen across someone who's infectious, whether they're sick or not, and if they're close enough for long enough. And then you can bring it home, and then you have a hot spot being fed, not because the initial infection was from that zip code, but that's where the transmission happens. So again, I apologize. I know it sounds like I'm talking in circles, and I'm trying to be clear.
Thank you, Doctor.
Okay. I see no further questions on that, so we'll now go to, I'm sorry, Commissioner Merman, you recognize.
Thank you, Mr. Chair. Dr. Holt, I really appreciate all the effort you're putting into this, because I know it's time consuming and you're worried and concerned for the community. And I think it's just commendable, the amount of effort you're putting in. I think that the questions, and going back to Sheriff Coster and then Vice Mayor Ross, can we put, and I guess it might require some extra funding, but can we put like a specialized response team together that could work with our neighborhood relations folks in some of these zip codes where you've got these high incidents in the timeframes, and really they know what's in the community. They can be a point of connection for a lot of the people, where they can pick up a face mask, they can pick up what they need, or even through the churches, our faith-based organizations. And I know that this would probably be out of your realm to be in charge of this, or maybe you could be, but if it's something you think that would help, then I think our teams here, our administration needs to, here at the county, needs to work with you and try and put that together. Because I do think that if we go into these communities where we're seeing this big spread of this virus, then we'll start to really micro-target where it's coming from and get the supplies to people wherever they need it. That could be testing, it could be anything. So I don't know what you think of that, if that would help, but just wanted to throw that out there. Thank you.
Yes, ma'am, you're spot on. And in fact, some of your staff in some of your offices have helped us make connections with the influencers in zip codes. As I think Commissioner Miller mentioned, he knows these communities intimately. We already have existing relationships through our Hillsborough County Healthcare Plan, our community resource centers. This is the time sort of to use all of those networks to mobilize the messaging. Again, we're in a battle. We need all hands on deck.
I know.
And we all need to be volunteers. It's not a mandate. We shouldn't be forcing people, but certainly we all want to be part of a joint effort. And we're seeing that. We just perhaps more coordinated or more visible is what you may be referring to, and I would love to be a part of that effort. I don't know if I should necessarily lead it, but we're a critical part. I'll stop there.
So, Mr. Chair, I guess I'm just asking, at the next meeting on Monday, I think Mr. Dudley's still on the phone. I know Gene Early's on the phone. If they can all get together and kind of give us a picture of what this would look like to really help out the Department of Health, because I think they're getting stretched. He's already told me that, he's told all of us about the contact tracers being stressed. And so I think that this would be very helpful, and to use some people from our EOC to possibly assist. So I guess that's my question to you, if we could direct our staff to possibly work with Dr. Holt on what this would look like going forward.
Okay, Mr. Dudley or Mr. Early, could you all have that prepared by Monday?
This is Mr. Dudley. Yes, sir.
Okay. Mr. Rivers, did you hear that?
Gene Early's in a healthcare advisory board meeting. So Mr. Dudley, if he could call Gene and work with him and put it together.
I'm here, Commissioner.
Oh, okay, great.
I'm still on. I'm going to that other meeting in a minute, but yes.
You could, you all can have that.
Dudley.
Mr. Early?
Yes.
You get with Mr. Dudley and have that prepared by Monday?
Yes, sir, we will.
Okay.
Thank you.
Anything else, Commissioner Merman?
No, that's all. Thank you.
Okay. Mayor Lott, you recognize.
Thank you. I'll make this quick. I appreciate the sheriff bringing this up. This is something that we discussed when we were opening things back up. Instead of, us as we move forward having orders that are mandates countywide and so forth, we discussed the contact tracing. We discussed the idea of recognizing the areas where there's hot spots and attacking those hot spots and remedying them that way, just like we've done in our assisted living facilities and nursing homes and so forth. So that model was the model of opening back up. And so I think it's a great idea. And Commissioner Merman, thank you for the idea there of additional funding. We have the funds that's been given to the county to be able to attack areas like this. And I shouldn't say attack, but to be able to go in and work harder in and put the emphasis there, right, where we know that we have hot spots. And so I support this effort 100%, and I hope that we work towards that and continue to work towards that. So thank you very much.
Dr. Holt, let me ask you a question since we're on this. You still there, sir?
Oh, of course. Yes, sir.
What were the zip codes that had the highest and major incidence of positive cases? Can you give the top 5?
Yes. If Kevin's still on, and we also, and I didn't mention, I think everyone got a zip code that had the same incidence for all 54 zip code. So each of you will should have that available.
But I can't sit on my computer right now. That's why I'm asking you that.
Okay. Yes, sir. You want me to
give me a second? Let me find it.
Everybody's talking. Whoa, folks! You can't all sing at the same time out of key. Now, someone was saying something there? What was it, Mr. Brewer?
No, Mr. Wagner said, "I'll try and find it, sir."
It was slide 12.
Yeah, it's got the top 10.
So, Dr. Holt, the top 5 zip codes would be 33602, 33607, 33610, 33613, and 33570. Am I reading that right?
Yes, you are, sir.
Okay.
By incidents per 1,000 over that 10-day period.
Okay, and of the top 5, the top 4 in the city limits of Tampa. Am I right, Mayor?
Mm-hmm. Yep.
Mayor Castor? All right?
Yes, without a doubt.
Yeah, that's what I thought. Thank you. Ms. Lopez and Dr. Eisenberg.
Thank you so much, Mr. Chairman, and good afternoon, EPG members. As you all know, I've been working with Ms. Lopez and her team to use the public input platform, which allows us to both do surveys and to take the pulse of community attitudes and behaviors, as well as to hold some community conversations, which Liana will tell you about in a little bit. I'm just going to quickly go through what we've learned so far. The survey that we launched closed yesterday, and so we have some preliminary findings, but not the complete findings. It's going to take us a couple days to do all the massaging. I do want to remind you, though, what Dr. Lockwood, how he characterized these kinds of studies some time ago. We're taking a still photo of a moving train, which is to say that I would imagine if we do this survey 3 weeks from now, we might get slightly different results. So this reflects a point in time. We have data from the survey was open from May 27th through the 16th, closed yesterday. 17,000 people responded. It actually is going to end up closer to 18,000. We got pretty good representation, about half over 35 years old and half under, which is relevant to the conversation we've been having, half with children at home and half without. And we asked the question, how many of you have already returned to a reopened business? And we found that 53% said they had, but 47% had still not done so. If you go into the lower age ranges, younger people, 62% have returned to a reopened business. So there is some difference in behavior by age. We asked in the survey, what is your main worry or concern about reopening? And these were the top 3 things that people cited. 66% said they were worried that people wouldn't practice social distancing. 58% were worried that people wouldn't wear masks. And 55% would say that people would go out when they were sick and not self-quarantine. We asked people in the future, what guidelines will you continue to practice to stay healthy as we reopen? And this was quite interesting. 76% of the 17,000 people said, I will continue to practice social distancing. 70% said they're going to wear a face covering when in public. And 54% said, I will only run essential errands. Then we dialed in specifically on this mask issue, which we're all so concerned about. We said, will you wear a mask going forward? And this was asked over the last 2 weeks or so. 75% said, yes, I will. 16% said, no, I don't currently wear a mask. And 7% said, no, I'm going to stop wearing a mask going out. So I think that's very interesting data to go along with the other epidemiological data that we've been hearing. But we found there were slight differences in intention going forward by age. So younger people were slightly less likely to say they would wear a mask. So 69% said they would wear a mask as compared to 74% of the next age group, 73% of the next age group. So there are some differences by age. So just as we're talking about a targeted approach to zip codes and hotspots, at least from a communication standpoint, we need to take a targeted approach to different age groups. And that's very, very relevant given the data that Dr. Chang shared about the changing age demographics in the hospital. Finally, I think this is close to the last slide. We asked specifically about businesses, and I put these 3 questions together because I want you to consider them all at once. We asked respondents, what would you like to see businesses do? And these are customers essentially saying, I would like businesses to require face coverings, face masks. 76% said that. 75% asked for hand sanitizing, and 74% said, please put markers down for social distancing. Then we asked people, if you are an employee, what would you like to see your employer do? And 66% said, I want hand sanitizers, social distancing markers, and 55% face covering. So a little bit less there. And then we see that business owners are rising to the occasion to a degree, but there is a gap between the percentage of business owners that are putting in place these precautions and what people, their customers and employees would like. So that's the takeaway from this slide, is that while business owners are doing some of these things, it's not to the extent perhaps that customers and employees would like them to do so. We then had many, many open-ended responses, actually 30,000 open-ended responses. So if we send you the file of data responses, it will crash your computer. But we pulled out some of them, and basically the majority want us to be cautious. And these are examples, I won't read them to you, but they reflect the data and the conversations that we've been having again today. But then a significant minority really want to press forward with a calculated risk, with opening and accept the risk, and you can see some of those as well. So in general, I think the feeling that we had is that we're looking at a sort of 75%, 25% split in how people are thinking about this. People are obviously still very, very concerned. And that's what we have today. Liana, do you want to add anything to that, please?
Yes, Eric mentioned the community conversations, which will be our next step. And so as you noticed on the data he presented, the employee and employer, there is that gap there. And there's also a gap between businesses reopening and people's comfort level with returning to businesses. And so our first community conversation is going to be held July 1st. It will be by invitation to retail, restaurant, and bar owners. We worked with our economic development department about 3 weeks ago to get a list of businesses that are throughout the county, so within the cities and within unincorporated Hillsborough County, so we would have a mix. And so that invitation will be going out, and we'll be holding a virtual community conversation with these leaders to see how we can help, what other things we can address, and what some of the frustrations and gaps are that they're experiencing. So other than that, I am open to questions, but I think that concludes our presentation. Correct, Eric?
Yes, indeed.
Okay, Ms. Lopez and Dr. Eisenberg, thank you very much. I'm trying to see if we have any questions at this time. And I do not see any at this time, okay? So thank you.
Okay, great. Commissioner Miller, excuse me, did you want me to address some of the questions at the front end related to the call center?
Yes, go ahead. Yes, please.
Okay, so I want to be clear with the members of the EPG. The testing call center is a partnership between our healthcare partners that manage the scheduling, the county's customer service and support department that provides overall support and integration into the county system, and our IIO department that provides the infrastructure support. Since Monday alone, there have been more than 23,000 calls handled at the 272-5900 number. Recognizing this isn't all for COVID or testing, and we do want to be transparent that the county's call center is still also supporting Department of Health's calls, but this should not be directly impacting the testing line, and they are included in this call handled number. Currently, the average hold time is approximately 30 minutes for the test scheduling line. Once in queue for the testing line, there is a hold message, and residents are advised of high call volume, and there is a significant hold time in order to be as transparent as possible. We had unprecedented call volume on Monday and Tuesday of this week. It was our highest call volume since the start of the pandemic. and it was compounded by a technical issue related to call capacity. Our IIO department quickly jumped in and solved the issue related to the call capacity. Please be aware we were transparent and messaged this to the public throughout the issue. We understand from our hospital system partners that manage the testing call center that we were not staffed at capacity and some team members were recently called back to regular duties. The county's HR department quickly identified 10 additional county employees that have been reassigned to support this call center, and they are on the floor as of this morning. We also sent a customer service center manager to the testing call center today to see if we could identify any other opportunities for support of this team or any process improvements or tools that the county could help provide or implement. You should be advised that we did request a review of the feasibility of an online reservation system early on in our response, and based on the time and the demand at the time, it was tabled. However, we made the request to our IIO department to move it forward as soon as possible, and they are currently researching a solution that can be quickly implemented and deployed. I also know Tim Dudley addressed the walk-up issue at the testing sites. I just want to emphasize that publicly in messaging, we still consider it a last resort option, and it's not pushed in our public messaging. While not turned away, we request that residents call 813-272-5900 for scheduling publicly, which is also the number for mobile testing. Walk-ups require more manpower and resources, and as testing increases, we need to ensure we do all we can to manage the resources effectively. I do want to publicly thank all the county teams and our community partners that work day in and day out to provide quality service to our residents and to ensure we get residents' schedules for testing as quickly and efficiently as possible. I hope that answers most of the questions I heard at the start of the meeting. I was logging on, but I am available for any additional questions.
Ms. Lopez, let me ask you a question. Does telephone system have the capability? Does it? Wait a minute, back up. Does it tell a person there's a long wait time and it could be up to 30 minutes? If that happens.
So it's not specific because wait times could be fluid and it's a manual process right now. We do not have a cloud-based system. That is something IIO is also seeking to see if we could quickly deploy a cloud-based system. So it is a manual process. So we can't manually tell someone, but we do say that it's a long hold time. And we are looking into seeing if there are options where we could be more specific, because my goal is to be as transparent as possible.
Okay, since you're looking into options, is there something out there that can tell a person there's a long wait time and we have a device that says, if you want to call back from us, push number 1 and we'll call you back when you're available? I mean, when we have availability, is anything like that available?
Yes, those are basic. Those are usually basic options in cloud-based systems, which is what IIO is currently looking at as well.
Okay.
That's a longer deployment. I'll just be honest, because it would impact our entire system, just not the scheduling system. So we need to be clear on that. But we are looking to see what we could quickly deploy within the next week or two.
Okay. All right. Just a thought. Okay. All right. Thank you very much. Thank you, Dr. Eisenberg. Mr. Wagner, Brandon Wagner.
Good afternoon, Mr. Chairman and members. Before you is a draft letter to the governor regarding the allowance for expanded telehealth usage via his executive orders. This issue had been discussed at the June 4th EPG meeting. The idea was put forth to have the EPG submit a letter that each of the cities and the county also do letters on their own if they wished, and to ask our legislative affairs teams to participate in advocating for this expanded telehealth and its continuation. At the time, there was no formal action taken by the EPG, so we're bringing this issue back for your consideration today. If you approve, we will process the letter with the chairman's signature and forward it, and then I will forward the final letter to each of the city governments for their consideration as well.
Okay, thank you, Mr. Wagner. Commissioner Overman, you recognize.
Thank you very much, Chair. And thank you, Ms. Wagner, for helping us put this together and bringing it back to the Emergency Policy Group for consideration and authorization. It's important that we realize the opportunity we've seen here. Clearly, the Crisis Center is dependent on having these available benefits available for their behavioral health. And even this morning during a call with our duly involved youth, they found that having the ability to telehealth to those children that are in the juvenile justice system and or the foster care system, having these resources available to work with those kids and those families has been a great resource for keeping those families stabilized during this difficult time. So I'm very glad that we're doing this, and I hope to see that it's authorized by the group. Thank you.
Okay. Mayor Ross, you recognize.
Thank you, Commissioner. Mr. Wagner, I just had a question really for my own clarification. I'm all in favor of it, but I read so many documents concerning this that I've kind of lost track. The order that's in place that is currently due to expire on July 7th that provides for these services virtually, are these services available as long as the state of emergency exists in the state of Florida? Or does the authorization for these virtual services expire prior to the state of emergency? Because at least one document I read, it seemed to say that these services would be available virtually as long as the state of emergency exists. And I just want to, just for my clarification, are we asking the governor to extend the ability to provide these virtual services as long as the emergency exists, or are we asking the governor to extend it beyond the state of emergency? Just a clarification.
Thank you, Mayor. The letter specifically speaks to telemedicine during the state of emergency. Part of the time delay between the request and bringing this letter to you was doing the research into the question. The governor's state of emergency allows for certain statutes to be temporarily suspended, and that was what allowed the state surgeon general to advance the furtherance of telemedicine. So the letter speaks specifically to that. It also speaks to the request for additional state funding, and it also highlights the value of the telemedicine process and the short amount of time that it's been employed. So, but to your question, it does speak to the state of emergency and any future extensions.
That's what I needed to know. Thank you.
Commissioner Overman, you recognize.
So do we need, if there are not any other further questions, do you need a motion to authorize sending the letter, or?
Yes, ma'am. Yes, I do.
Then I move that we authorize sending this letter to the governor, asking for his assistance in expanding this program throughout the emergency and otherwise.
Is there a second?
Second.
Who was that? We have a motion by Commissioner Overman, second by Commissioner Merman. Seeing no further discussion, please call the roll.
Miller?
Yes.
Overman?
Yes.
Merman?
Yes.
Cronister?
Yes.
Castor?
Yes.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
All right, motion carried 8-0.
Okay, thank you, Mr. Wagner. Is there anything else?
No, sir, thank you.
Okay, thank you. Ms. Christine Beck, County Attorney.
Yes, Chair Miller and EPG board members, Christine Beck. You have in your backup materials a draft extension of the emergency, the order extending the state of local emergency for your consideration. And then the only other thing I would note is that you've probably read in the paper and been made aware that yesterday the city of St. Petersburg issued an order, and I'm available for questions relating to that or any follow-up questions based on the conversation earlier.
Okay, let's take up the extension of emergency order first. And we have a motion to approve.
Move to extend.
Second.
Motion by Commissioner Overman, motion by Commissioner Merman, second by Commissioner Overman to extend the emergency order. Seeing no further discussions, please call the roll.
Miller?
Yes.
Overman,
Yes. Yes.
Merman,
Yes.
Cronister,
Yes.
Castor,
Yes.
Ross,
Yes.
Slot,
Yes.
Snively.
Yes.
Motion carried 8-0.
Now, Ms. Beck, I think you were asked a question by Commissioner Overman earlier, and we were told you would address that question at this point. So are you prepared?
Well, it might be helpful, Commissioner, if she could just restate her question.
Okay, Commissioner Overman, you want to restate your question?
Thank you. Thank you very much. Previously, as we looked at guidelines for reopening, there was a series of metrics that we needed to make in order to adopt a reopening process. One of that was a 14 rolling day period. We have reopening steps 1, and we have reopening phase 2. What steps within 1 or 2 are we precluded from doing anything other than what the governor tells us to do? And what steps could we consider adopting that may mitigate the community spread that we're seeing within our communities?
Yes, Commissioner. So those criteria were criteria that were used by the state when the state rolled out their reopening plans and the various phases, and ultimately in the orders that effectuated the task force plan, which was, as we've talked about, slightly different than some of the criteria in the plans. Those really were guidelines that the state was using, and what's our obligation is to follow the orders from the state. However, those orders have made it clear that local jurisdictions can be more restrictive and are not preempted in many ways. We cannot totally conflict what the governor has required, but we can be more restrictive as long as we're not, totally inconsistent. So that's why you see some orders regarding the masks, which are legally allowed. But if we wanted to say that restaurants cannot open, I think that would arguably be in conflict with the governor's orders. So those are just 2 examples. Does that answer your question?
Somewhat, yes. I think it's because we're looking at a situation where doing nothing, it doesn't appear to be an option. And making recommendations that are addressing our hotspots may be appropriate. We have a mayor across the waters that has set guidelines for businesses in his community that require masks of the employees and people who work indoors of businesses. And then based on our survey response, it appears as though people are looking for businesses that will do that. So that, maybe we might drive across the bay to do business with that business because they are wearing masks when we're not in our communities as much. So I'm looking for ways that we, one, help our business owners be successful and reduce the impact of those businesses that have to close because they've had an infection in their employee base. And we are seeing that happen here in Hillsborough County, where businesses have had to stop doing business for a bit because they've had multiple exposures within their employee group and customer group as well. So I'm looking for ways that we help support our businesses and things that we can do to help them survive this, because whether or not we pull businesses back or not, we're going to start seeing businesses having to close because of the level of exposure that we're starting to see. So whether we do it or COVID does it, it looks like we're going to get there where it's going to happen anyway. So I'd like to be more proactive than that, if possible. Are there any ideas from the current group that you'd like to suggest?
Commissioner Merman, you recognize.
Okay, so you asked. I do think that we're at a point where we kind of have to take matters into our own hands. I agree totally with Mayor Castor that there's probably a huge underestimation of the numbers. And we could be going into an out of control, spiraling down up situation. And I believe this group has an obligation to lead and to keep everybody safe as possible. I think we should ask, and Commissioner Overman, you have been the champion, so I won't make the motion, but I think that we should have our county attorney draft a policy for businesses, much like the St. Pete. Yesterday at the county commission meeting, I asked Commissioner Miller as our chair to send letters to all the chambers and to the ED Economic Development Council to ask them to please be nice. I mean, we're trying the be nice approach and ask the businesses to please wear masks, and then people walking inside wear a mask. But I think that we can let this simmer, but I would like to see something come back Monday that really tries to help our residents stay safer. And that is by, if they do go to a business, and this includes grocery stores and essential businesses, that the employees would have to wear masks, but also the people going in the store would have to wear a mask. And I think this is a very reasonable compromise. We're not mandating masks for people to wear out there, but if they are going to leave their house and go to a place, I do think that it's just going to play a major role to stop the spread. And we need to move forward, but this will give us a few days to hear from the public and see, because every time we propose something, it opens up the floodgates. Commissioner Miller, you mentioned this a lot, with emails. So that's what I think at this point.
Is that a motion?
I
second it.
Well, no, I was going to let you make it because you've been the one that's been the proponent of this. But it's really not to pass it today, but to draft a policy to come back on Monday. So if you want to do that, I'll second it.
All right, I'll make that motion.
There's a motion by Commissioner Overman, second by Commissioner Merman. Mayor Castor, you recognize.
I'll wait until after. I'll hold my comments until after this vote. Thank you.
Okay, all right. Again, we have a motion by Commissioner. Hold up. We have a motion by Mayor Ross. You recognize.
Thank you, Commissioner. I'd just like to, I guess this is kind of for Ms. Beck, is I assume we're going to see the language of this on Monday, I would assume. I just hope that this is very carefully crafted and that there's, I can think of businesses that I think should be some small businesses that don't have 50 people, they're not, things like that. I do think we need to preserve a business owner's right to choose what goes on inside their business, particularly some businesses aren't even really open to the public unless you're allowed in. And so some of our orders tend to be rather broad and vague. I thought that of the last one that made it a violation to interfere or attempt to interfere with any person in any public or private setting to wear a mask, which that's pretty vague. So I would just ask that this be kind of crafted carefully, and we'll look at it on Monday. So,
agree.
Mayor Lott, you recognize.
Yes,
Mayor Lott, hold on a minute. Hold on, Mayor Lott. Ms. Beck, were you going to say something?
Commissioner, I was just going to say that I understand his concerns and that he wants to ensure that there's appropriate exceptions with any order that we bring back. So we'll absolutely do our best to accommodate that.
Right.
Okay. Mayor Lott, you recognize.
Thank you. Is the word mandate going to be used in this order?
Commissioner Overman or Commissioner Merman, you all made the motion. Maybe you need to clarify your motion, restate it again.
I believe the motion, I agree with Commissioner Merman, would be in line with what we've seen with what St. Pete has done.
So the answer is yes.
So the answer would be yes when it comes to if you are in public and doing business inside a building, the employees are required to wear masks when you come in contact with someone. And if you are going to a business, that you're required to wear face coverings. It doesn't mean you wear them all the time. It just means when you're coming in contact with other people, you're going to use protective measures to mitigate the spread. Ms. Beck, is that in line with what you interpreted the language that was described with Mayor Preston's orders that he put in place yesterday, or goes into effect tomorrow night?
Yes, Commissioner, it is a mandate, it's a shall, and it becomes effective at 5 p.m. tomorrow. However, there are a number of exceptions. For example, if wearing a face covering is fundamentally incompatible with the job task performed by a person, the requirements don't apply. They don't apply while eating or drinking. They don't apply while exercising. They don't apply if you're hearing impaired. I won't read them all, but there are a number of exceptions contained in that order.
Okay, great. So we are just literally putting a motion forward to look at the language on Monday. Is that correct?
Right.
Excellent.
Well, since the language would be a mandate, then I will not be voting for bringing this ordinance back on Monday. Thank you.
Ms. Snively, you recognize.
Thank you, Chair. I also am not interested in mandating face masks. First, I'm sure everyone's emails are going to, I don't know, mine broke last time we tried to mandate something. And so this will be interesting to hear constituent feedback over the next few days, but I think my email will probably go break all over again. But as you know, as a small business owner myself, I have 8 employees, and I'm taking the precautions myself to give my employees the opportunity to social distance within my office, as well as customers who come into my storefront, the option to wear a mask or not wear a mask. I have hand sanitizing stations. I have masks available to my employees and to my customers. So as a private business owner, honestly, I don't appreciate the mandate. I'm doing the responsible things. I know that maybe not every single business owner is, but I still think that if we continue to educate people about the importance and the safe practices that they can take as business owners for their employees and for their customers, I don't think it's necessary to mandate something like that. I think business owners, if they're unfortunately, you know, there are some that are probably not going to put the safe practices in place. That is a risk that they will have to take as an employer. If I don't do the right thing for my employees and if I don't do the right thing for my customers, that's on me. That's my liability, and I have to take that as a private business owner. So I'm not interested in doing that, and I probably speak for a lot of small businesses out there as a previous chair of my Chamber of Commerce and very involved business owner in my community in Eastern Hillsborough County. I can tell you, not interested in any type of mandate that's going to force business owners to do something like that. So I can't support it at this time.
Jeff Cronster, you recognize.
Thank you, Mr. Chair. And I believe this is a question for Ms. Beck. If you're talking about it being mandatory, can you explain who's responsible for the enforcement?
Yes, Sheriff Chronister, the way that the orders are typically drafted is that they can be up to a second-degree misdemeanor. However, they can be lesser than that, so that they ought to be a civil citation, but I do believe that that enforcement obligation would largely fall on law enforcement.
Well, and I'm sure, I guess my follow-up to that is, I'm sure everyone in this group can understand the complexity or concerns that it would have to have something mandatory, and the confusion that will be caused that now you're asking law enforcement to enforce mandatory masks.
Commissioner Merriman, you recognize.
Thank you, Mr. Chair. I really appreciate your all's thoughts because I knew that this would obviously blow it up because I have been on this other side for so long that I am very worried about this increase. Much more worried than when we shut down Hillsborough County. And if it's, tell me what other solution we have. Education? Come on. Everything we put out at the county, at the city, everywhere is all trying to educate people. And I understand, I like mandates, but we are trying to keep people safe. Bottom line. And if this thing spirals out of control, you know, it's going to look bad on us. We're the leaders on this committee. So I guess what I'm saying out there, we're just going to look at wording. If we want to just do it for 1 week, I don't know. If it stops the spread, which I'm hearing it will, every major hospital now has come out and said, we need something. So if there's another solution to offer on the table, that's fine. But we have to do something. And I've seen other cities, San Antonio, you know, there's a lot of ideas to craft this policy so that it works, so that everybody's happy with. Maybe we just do it inside the city of Tampa, since that's where the biggest spread is. I'm not sure, but let's get our ideas to Christine Beck. Let her craft something. We'll discuss it on Monday and see where we are. But to have the spike in numbers, I feel it is our responsibility because we're going to be held accountable. And that at the end of the day, I want to say I erred on the side of safety of our residents. That's it. Thank you.
Let me ask a question, and somebody please answer this for me, because I'm getting a little perturbed now. Besides those people or children that can't wear a mask for whatever reason, there may be that they have a breathing disorder or asthma or something like that, or besides the constitutional right or your political philosophy, what's the problem with wearing a mask to cut down on the numbers that went from 244 yesterday to 337 today? Somebody please explain that to me. I'm open. Listen.
May I break in here?
Who's that?
This is Dr. Unesh.
Yes, sir. Go ahead.
I'm going to try and make an appeal for swift and decisive action on the part of the EPG here. The latest calculations I did this morning indicate that this is in Hillsborough County, this is now doubling at a rate of once every 5 days, which is faster than the state of Florida as a whole, which is about once every 7 days. If trends continue, my calculations and the models that we're running indicate that this will peak sometime around July 17th, at which point in the Tampa Bay area, we will have 1 million people who have been infected with this virus. That's 50% of our population. If we do nothing, we can close this whole system down and not worry about this by early September. But at that point, we're going to have 70% of our population who had this disease, and God knows how many dead bodies laying in the streets. Please, please do something to bend this curve. If we don't do this, and if we don't act quickly, this is growing exponentially now. Every day is precious.
Thank you, Dr. Unesh. Does anyone else want to answer my question?
No,
thank
you.
What was your question again?
My question is, we're seeing the numbers rise, just like Dr. Nunes just said. Yesterday, we went from 244 today to 337. That's almost 100 per day. Besides the mere fact is that there may be some people out there, because of respiratory problems, children with respiratory problems, can't wear a mask. besides the constitutionality of people saying I have a right not to, or your political philosophies, what else is there to say we shouldn't be wearing masks when the numbers are going up? You just heard Dr. Nunes say what he just said. And we've been told, even by the Florida Surgeon General, that masks stop the spread of this virus. Tell me what's the problem with us not saying something about a mandatory mask. Tell me, please, I want to know. Okay. Mr. Merrill, you recognize.
It may not be worth fighting over.
Mr. Merrill?
Is there someone else who was? I heard someone else.
I didn't hear anyone, sir. So go ahead. You recognize.
Oh, okay. Yeah. So I mean, I'll just offer this as an observation. I'm not the sheriff. I don't, have the understanding and expertise, and I'm not at all. I think Chad raises a very good point. The way I look at this and the way that I've been talking about it is that businesses now have an obligation to, if someone walks into their business smoking, they have an obligation to tell them to go outside and smoke, because we have a law that says we can't smoke in buildings and in other certain areas. So I certainly wouldn't want the sheriff to have to, dilute all of his resources when we're trying to deal with civil unrest and everything to have to go around and enforce this. I think the spirit of this, to kind of support Commissioner Merman's point of view here, which I think is important. I mean, I talk to the hospitals every day pretty much and talk to a couple CEOs. Like it or not, I mean, I think we're not asking businesses to do any more than what they're doing now,
right?
Dealing with the smoking ban, which we have come to accept as a society. And that won't be perfect, clearly, but this is kind of trying to deal with the odds of improving the odds for our community. So I would suggest that, that's a workable solution that addresses a really good question that the sheriff raises. And the same would apply to the City of Tampa Police. I have been talking to the CEOs of our 4 hospitals as early as this morning. And they are prepared to be here on Monday at your next meeting and just give you the inside view of what they're seeing, because they have a concern not only about public health, but about the economy. And I think they bring a valuable perspective here. So I think it's good that Commissioner Merman's asked us to come back on Monday. That can be married up with, another point of view under these conditions. It may or may not change people's minds, but and I think it is important to hear from them, because they're not only public health, they have a public health responsibility, but as CEOs, they have a business responsibility to their employees, to their shareholders, and so forth. So I think that may help as well, but just offer that as a perspective.
I like it.
Thank you, Mr. Merrill. Mayor Cassidy, do you want to talk now?
Yes, I can go ahead and talk now. I was going to wait until the vote. It doesn't look like it's going to go too far. To Ms. Snively's point, she's talking about how many individuals that she has received emails from. The Hillsborough County's own data just said that the overwhelming number of citizens wear face masks and want a face mask. 6%, I believe they said. We have had a 900% increase in cases in the city of Tampa in the last month. There's been an 800% Hillsborough County. We in the city of Tampa have 4 out of 5 of the zip codes that are increasing dramatically. And I think we can all agree that this is on an upward trajectory, and the positive cases right now are probably woefully underestimated. We're seeing that the young people are taking it back home. And while I appreciate the idea of hotspot focus, this is an emergency now. It's past the point of, of us taking time we just don't have the luxury of that right now. When I tried to get the mask ordinance back, I think in April, and it failed, we put our efforts into getting cooperation. We got the grocery stores, we got the home improvements, we got the pharmacies. Our Lift Up Local required all of the restaurants that participated to have their employees wear masks. And they've all done that, but we're still seeing that increase. And all of the data is unquestionable. If we wear masks, we can put an end to the spread of them. That is the bottom line. So to Sheriff Cronister's point, put the safer at home in, people abided by it. The community is looking for leadership, and that's what they need from us right now. So I intend to we have shared the ordinance that has taken care of all of the challenges. It's addressed the challenges throughout the city. We also provided a draft ordinance that allowed, if cities wanted to opt out, if Plant City doesn't feel that their residents need to wear masks, then they can opt out of it. We've presented both of those ordinances drafts to the county attorney. We've got Miami-Dade, Broward, Alachua, Osceola, Monroe. Pinellas is getting ready to pass one. Orange County is. The only reason St. Pete did just employ because they couldn't get a mandatory mask ordinance together in time. Palm Beach is the only southern urbanized county that doesn't have a mask ordinance, and we're currently in a race for first place in the number of cases with the county. So I'm going to put a mandatory mask ordinance for the city of Tampa right now to protect our citizens. And I would hope that I've talked to Mr. Merrill and talked about being a team player and waiting. But if we wait till Monday for a draft, then we're talking about another week. And we heard Dr. Unich talk about the increase on a daily basis of this. So I intend, everyone's seen the videotapes from the bars. Those are just peak dishes at this point. In our ordinance, it's going to be a civil citation, but I expect that the majority of individuals are wanting that direction from the leaders in our community. And I'm going to provide that direction in a ordinance for the city of Tampa. Thank you.
Thank you, Mayor. Mayor Lott, you recognize.
Thank you. With all due respect to Mr. Merrill, because I love him dearly, and he's an amazing leader to our county. I think the vast difference between using the analogy of smoking is that majority of citizens don't smoke. So there's only a small percentage of those citizens that that can't go inside and smoke in a restaurant. And what we're doing here now is we're making 100% of people, versus to just a smaller number of people. So that's the way I look at that view. Okay. The next thing is that I was asked how to support a vote. I wasn't going to go into all the details, but I'm going to tell you I got pages of here, and I'm trying to decide what do I go through in all these pages to support the reason why I don't go forward with a mandate. Let's go back to the beginning. Our job was never to find the cure for COVID. Our job was to not overwhelm the medical system and our hospitals. That was our mission. So if I look at between April 15th to 6/15, ICU patients in ICU with COVID is down 43%. Those with ventilators is down 56%. The total ER volume in Hillsborough County alone is down 25%. Deaths are down 40%. Okay, and the average age for a positive with COVID now is now 37. That's drastically down. So if I looked at the numbers that we looked at earlier, we're at 5% capacity for the bed use and our hospitals in Hillsborough County. We had 2 individuals state that we're nowhere near close to overrunning our current system. So when you look at the positive rate, I think that we're sitting, we don't want anyone to have COVID, but if we're looking at the perfect scenario, is that the numbers are down in our elderly, okay? Our youth are get back to work, which is what's happening. We're looking at the numbers, even the poll showed it. Our elderly or older population is, and the percentage of them are staying at home. The younger population, which is who we want to get back to work, is back to work. They're getting infected, but the but the numbers are they're driving down in every other category. So I think right now, and the way I look at it, we're in the perfect scenario, other than if we had no COVID at all. Okay, so to build we also had some mass gatherings here recently. Okay, and I guess we don't want to really discuss it, but the mass gatherings had to have an impact on these numbers. There's no way you have that many people gathering, okay, and not have an influx in the numbers, because we've all agreed social distancing, not groups greater than 50 and so forth. You know, that occurred in our county, throughout our county, okay, and so I believe that spike has to be there. So to be able to not, for us not to recognize that some of that spike has to come from the mass gatherings that we've had, I think is not responsible on our part. Our quarantine sites at 0, our isolation sites at 15. The numbers are all really in good shape. The county administrator has added 60 new beds. So only thing I'm looking at right now is the positive rates going up, but it's in our youth, and the numbers are going up, which we know would happen because our testing is going up. So to me, this is going as planned. Okay, so for us to place, a order, especially at this point in time, that is a mandate, I just can't support it. I do understand that we have 4 zip codes that are in Tampa, and if we need to do something special for those 4 zip codes, maybe I could support that, but I'd still have a hard time supporting a mandate. But to be able to put mandates in areas like Dover and Cork and Waimama, Plant City, and other areas like that where the numbers are so low in, it doesn't make sense having the same policy in 33602 as you would 33566. So at this point in time, if we hear from the doctors on Monday and we still have another, if we want to change our opinion, we can do it then. But to right now, I do not want to send a message to the citizens of Hillsborough County that we're bringing a mandate to them that we're going to vote on Monday. So again, I'll still vote no on this. Thank you very much. Commissioner Merman, you recognize.
Thank you, Mr. Chair. Mayor Lott, I have the utmost respect for you and always have had. What I'm only saying today is to have a policy come back. That's the only decision today. And that's why I said all of you can give your ideas to Christine Beck about, it's things that you'd like to have in this policy, but I am not proposing an approval to a mandate today. And I am only asking that we ask our county attorney to bring back a policy with our ideas and suggestions to help curb the spread of this terrible virus. I think it's out of control. I think some of the numbers you brought up, like hospital ED visits are way up, hospitalizations are increasing. But listen, at this point, our economy is starting to get back on its feet. If this thing gets worse, it is going to kill jobs and kill our economy. And then that is going to be on us. So I'm just saying to everybody, and I don't I don't want the sheriff and the police department to be on patrol for mass people. I really think citation, if anything, is probably end up being a warning and an education. But I think that that's it. It's only to bring back a policy. It's not to approve a mandate today. It's to bring back a policy. Thank you. Appreciate y'all.
Ms. Lively, you recognize.
Thank you, Chair. And I appreciate your comments, Commissioner Merman. I respect you a lot for what you're trying to do. And I know that even though you're just trying to bring back some language for us to review or possibly vote on at our next EPG meeting, that it's still going to create a lot of confusion in our community about what we're trying to accomplish. And so, Mayor Lott, what you said, you encapsulated a lot of what I also agree with. We are at 5% hospital capacity, and I really want to thank Mayor Castor for taking the action that she's taking, because I do believe that if you have an issue in some concentrated areas of the county, that you focus on applying whatever needs to be done in those particular areas, and focus on that as opposed to mandating it across the entire county. I mean, the zip code I live in has 23 cases total, but you're going to, consider mandating masks for everybody in various parts of the county that have a very little rate of positivity. And so I think that seeing what happens from Mayor Castor's decision, maybe we should monitor that and see if that makes a difference. Because yes, we have had mass gatherings. Maybe the spike is an anomaly. Maybe it's because of the mass gatherings that have occurred that have created an increase in positive rates, and that's definitely something to consider. You just can't ignore the fact that we've had such mass gatherings, and you've seen them on televised, that half the people aren't wearing masks, and they're definitely not social distancing from each other. So you can't tell me that doesn't have something to do with the rate of positivity in our county, the spike that we've seen. I would really like us to see if Mayor Castor's mandate makes a difference in those particular areas. And then if it does, if it makes a significant difference, or maybe it does, maybe it doesn't, maybe then have a conversation about the results of that. Maybe it squashes all of the issue that we have completely of this thing spreading. Maybe it doesn't make a difference at all, but I think it's worth watching and seeing what happens in those four out of those 5 zip codes that have the highest rate, and seeing what the results are from that after a week or 2 weeks. So I'm still not interested in really bringing this back at this juncture. I think all the statistics that Mayor Lott shared, they're very valid, and they should be considered at this point in time. So thank you again. Not really wanting to support the further discussion of a mandate at this juncture. Thanks.
Mayor Ross, you recognize.
Thank you, Commissioner. I'm really reluctant to kind of wade into this now, but I can see all sides of this. I really can. And I tend to agree with Member Snively and Mayor Lott on this and most things usually. But I also can see the spike that is real, and it is concerning. And I also can relate to the sheriff, and I'm not anxious for our police department to become the mask police either. And you can talk about, well, we're just going to give really stern warnings, or that's not, I mean, you still have to take up time and respond to these complaints, and you will get the complaints. There will be people calling and complaining that I went to such and such business and they weren't wearing a mask, and you got to do something with that. So that's not a small concern. I would like to say that just because I may support this initial move to have Christine draft something does not signal that I'm necessarily going to support this on Monday, because there are some things that I'd like to see in here. And I think if we're careful and we're thoughtful, and generally we all of us are, that we may take this and be able to craft something that all of us can live with. I agree with Rick, Lott, and Melissa that I'm not interested in mandating this all over the county for everybody. I think that's overkill. However, there may be some things that we can do that would work. Maybe if you have a business that has the capacity for over a certain number of people, then you got to wear a mask. Maybe if once you get into business, if the nature of your activity is socially distanced, you only need to wear the mask while you're close by somebody, and then you can take it off. I don't know. There's probably some things we can do. There's some things that we're not even talking about that we clearly have the authority to do, and that to go back to reducing the size of gatherings. Nobody's even brought that up. We have the power to do that, and nobody's even talking about that. All we're talking about is masks. So maybe we can take all of these things, and Christine can come up with a way to say, if you're in a crowd of over X number of people or a store that has X number of people and you're unable to be 6 feet apart at all times, then you got to wear a mask. But if you can be 6 feet apart, maybe there's a way to do this. But I do agree with Mayor Castor that I do think it's obvious these numbers are climbing. We do need to do something. I don't think it's helpful to talk about there being bodies in the street. I don't think that's helpful for the agenda at all. The public hears that. And first of all, I think it takes away from our discussion here. I don't think that's appropriate, but I do think the numbers are increasing and we're hearing that week after week. So I will vote in favor of seeing what Christine comes up with, but I don't want that to be taken as I'm necessarily going to vote in favor of it. And maybe what she comes up with Monday is a starting point, and then we can narrow it down to something we can all live with.
Right. That's right.
Mr. Merrill, you recognize. Mr. Merrill?
Mr. Merrill, we cannot hear you.
There we go. Sorry. I want to thank Mayor Ross. I think those are spot on comments that I really think it's important for you all to have this conversation, to hear from the CEOs. It will be compelling testimony by the CEOs who are looking out in front of this. They're looking out in the future, they're the near future. They're not looking necessarily at what's in front of us today, but what's coming. As it relates to Dr. Unash's report, I have a lot of respect for Dr. Unash, and he's been a very important part of this. I just want everyone to know that he was not on the agenda, and neither Dr. Holt nor anybody has had an opportunity to vet his information. That's not at all to discredit him. I think that was an important point. Also want to remind everyone that 2/3 of the population of this county do not live in cities. They live in the unincorporated county. I also want to try and maybe clarify, because hotspots have come up a couple of times, maybe to help Doug and what Dr. Holt, what he was trying to say. Hotspots are not the origin of the virus. Hotspots are where the people live who bring the virus back into the zip code. The virus doesn't respect zip code boundaries, doesn't respect jurisdictional boundaries, doesn't respect anything. I think that what Commissioner Merman, you can correct me if I'm wrong, but I think what you were asking the county attorney to do is get a draft out to the EPG before Monday so that everyone would have a chance to look at it, so that if there was a desire, then on Monday, there would be no impediment to the group acting on it.
That is correct.
So I just wanted to, again, offer those perspectives. Thank you.
Ms. Stively, you recognize.
Can I call the question?
Sorry, I need to put my hand down. Sorry, I meant to put my hand down.
Okay. Commissioner Overman, you recognize.
Thank you. And I just want to make two comments, and then I'd like to call the question because the day's getting long, and we need our legal staff, to bring us back something before Monday. In our work, and as we phased out, 62% of the people that responded to our survey were the ages of 18 to 25, and they've returned to a reopened business. They're out working. 53% have returned, but 47% have not returned to work of the people that responded. So we do have people out there working, and we now have a spike in numbers. And all of these increases didn't occur when our gatherings occurred. They occurred as our businesses started opening and as the people were coming in contact with each other. And it does take about 20 to 14 to 20 days to start seeing the impact of those behaviors. So while we're talking about getting together and deciding what we're going to do on Monday, and then maybe do something next Thursday, every day is another 4 to 5 people. And in the case that Commissioner Miller made, another 100 people more than the 100 before, the 200 before. So every day we delay making something happen is important. And so if the Mayor Castor decides to do something, I don't blame her, because that's where the majority of the people that live that are being impacted the most. And what I also know is that people in the city don't always know whether they're in the city or the county. So I think we need to make that very clear. But I would like to call the motion, please, so that we can actually move forward in making a decision to actually consider something to help our citizens know what they can do or should do and must do to stop the spread of this virus.
We have a motion by Commissioner Overman, second by Commissioner Merman. Please call the roll.
Miller,
Yes.
Overman,
Yes.
Merman,
Yes.
Cronister,
No.
Castor,
Yes.
Ross,
Yes.
Watt,
No.
Snively.
No.
Motion carried 5-3 with Sheriff Cronister, Mayor Lott, and Ms. Snively voting no.
Okay. Ms. Beck, is there anything else you need to bring forth?
No, sir, Chair.
Okay. Is there any other discussions we did have as a body? Any other discussions we did have as a body?
Nope.
Mr. Merrill, you recognize?
Nothing from us, no.
Commissioner Overman, you recognize?
I'm so sorry. I forgot to take my hand down. I apologize.
Okay. All right. Seeing no further hands, everyone have a great weekend, and we'll adjourn.